OSHA requirements in healthcare post-COVID-19 pandemic. This webinar has graciously been supported by Babasaheb Bhimrao Ambedkar University, Lucknow, and our Honorable Vice Chancellor, Professor Sanjay Singh, United Institute of Pharmacy, Delhi, Prayagraj, and UCER, Greater Noida, and Dr. Alok Mukherjee have played a pivotal role in organizing this seminar. Mr. G.G. Gulati, the chairman, Dr. Jagdish Gulati, the president, and Mr. Gaurav Gulati, the vice president. They have been rock-solid pillars of support. Around 2,000 delegates have registered for this webinar. I think they are yet logging in because it's a little early in the morning, but probably we will soon have all of them on board. And we hope you shall enjoy these 4 lectures that we have in these 2 sessions. One session is a post-lunch session. Now, coming over to presenting our first speaker for the day. The first speaker for the day is the esteemed Dr. Sanjay Jain, who is a professor of pharmaceutics and presently the head Department of Pharmaceutical Sciences, Dr. Hari Singh Gaur, Central University, Sagar. Sir is the chairman of Council for Industry Higher Education Collaboration, chairman of University Innovation Council, chairman of University IPR Cell. He was also the former dean of the School of Engineering and Technology, with over 30 years of experience in teaching and research and 2 years in industry. He has more than 180 research publications, and more than 20 patents, 1 euro patent US patent, and 3 Indian patents which are filed. His main research area is new drug delivery systems for the treatment of diseases associated with gastrointestinal tract and brain. Recently, he has been conferred India's most prestigious and highest award, Visitors Award 2018, by the Honorable President of India, Shri Ram Ji Additives. On the second meeting, also been awarded Best Research Paper Prize. Besides this, conferred with the Best Research Award in Pharmaceutical Technology, Award for Research Excellence by ISRA Netherlands, and the Dr. R.K. Upadhyay. And when was I audible? Professor Jain, your introduction, how much of it could you hear?
No, it is okay. It is okay. You know? Okay. I think I should start now.
Okay, so I'll just hand over to you. The topic for today's lecture is Challenges for Pharmacists in the Present and Post-Pandemic COVID-19. So over to Professor Sanjay Jain. Let's all mute our mics so that we can carefully listen with no disturbances.
Okay, thank you. Is it audible to all of you?
Yeah. Yes, sir. All muted.
Okay. So, thank you, Professor Shubhni, for introducing me to the audience. I'm really happy to interact with you people on such webinar. And today I will be speaking on the most burning problem of today's of the global, that is the COVID-19. I will be telling you something about the coronaviruses, and then what will be our role to overcome this problem, or during this problem, what will be our duties. So now, should I share my screen? Yeah. Okay. Is it visible? My screen is visible. Visible. Okay. Okay. So today I will be talking about dangerous, as one previous one reported, that the MERS and SARS-CoV virus. It is the more dangerous, and it also affected. It is affecting the human respiratory system, causing cough, cold, fever in initial stage. But in later stage, it infects whole respiratory system, which causes death to the infected person. The whole WHO originally named this as novel coronavirus infected pneumonia, NCIP, And on 11th February 2020, WHO officially renamed this clinical condition as COVID-19. The RO rate of this SARS-CoV-2 or coronavirus, novel coronavirus 2 is between 2.2 to 3.28. That is the average. RO is the one individual infected, how many individual, average, in average. So that is in each infected individual on average causes 2 to 3 new infections. The incubation time, if you see that of this coronavirus, that is the that is estimated to 14 to 25 days in the adults, but in pediatrics population it is shorter than 14 to 25 days. Some mutations, as you know, this coronavirus, novel coronavirus 2 is mutated very fast, and because of that fast mutation, our scientists are unable to produce a vaccine of this virus because of fast mutation of this, and they are and it is that is why they are taking a lot of time to investigate this produce coronavirus. So through the throat, as you know, then enters in his lungs and multiply, causing breathing difficulties. Scientists, especially in India, said that A2A mutation alters a component of the spike protein of the coronavirus cell, that is ACE2. This is the entry point. From ACE2 of the host cell or human being, this virus will enter. So COVID-19 has emerged as a pandemic because of the A2A type's ability to transmit easily into the host cell. Recently, it is reported that 2 strains of coronavirus are spreading in India, that is S and L type. And it is said that L is more dangerous than S type coronavirus. The patient infected with L type of coronavirus are taking more time to recover, and more deaths are reported as compared to the S type. If you see the distribution of this virus to the whole world, then you will find that the virus which was originated from the country, that is China, only 1.83% it was distributed, but after that it is spread to the whole world, and most affected country, that is the United States of America, that is 32.22% people are infected with this novel coronavirus, or they are having the COVID-19 disease. If you see the spectrum of the disease severity of COVID-19, then COVID-19, as you know, the first reported in 31st December 2019. The mild illness was reported in 81 patients, and severe illness, that is hypoxemia, that is greater than 50%, and pneumonia in 14%, severe pneumonia in 14%. In critical cases where there is a respiratory failure, shock, multiple organ dysfunction syndrome was reported in 5%, ERDs, sepsis, septic shocks, or myocardial infarction. Overall fertility rate was between, it is a figure of 27th February 2020, that was 2.3 to 5%. The mortality in most cases has been in the elderly and individual with comorbidities or weakened immune. Comorbidities means those human beings having the diabetes, heart problem. So S protein is responsible to enter through this S protein. This is the pink one is the S protein, so that it will enter into the host cell, right, including the two subunit S1 and S2, and then it will reassemble, then it will transmit the content into the cytoplasm of the cell, and then it will reassemble and release from the cell. So host factors, that is of SARS-CoV-2 receptor human, that is a human angiotensin converting enzyme 2, that is ACE2, so that it will enter into the lungs, and then individuals who are more susceptible to the severe disease, that is the elderly patient, those who are over 65 years of age, or people with underlying diseases like heart disease, cancer, or diabetes. So the underlying health conditions that increase the susceptibility, that is the hypertension, chronic obstructive pulmonary disease, or like pneumonia, diabetes, or cardiovascular disease. So under this condition, the susceptibility of this coronavirus is increased. Severe complications like respiratory disease syndrome, septic attack, metabolic acidosis, hard to correct, and coagulation dysfunction, and multi-organ failures. Say recently, yesterday in the press conference of WHO, one symptoms they have reported that is also very alarming. In United States, some of the children reported multi-systems inflammatory syndrome, and it is really a severe syndrome that is observed, but Americans are correlating it with the coronavirus, but still our scientists are working and finding out the cause of this multi-inflammatory syndrome. You see the life cycle of the coronavirus 2 in the host cell. The life cycle of coronavirus 2 in host cell began when S protein binds to the cellular receptor ACE2 in the host cell. And after receptor binding, the conformation change in the S protein facilitate viral envelope fusion with the cell membrane through the endosomal pathway. So through the endocytosis, this content or whole virus will enter into the cell of the host cell. Then SARS-CoV release, and after entering into the host cell, the SARS-CoV releases RNA into the host cell. The genome RNA is translated into the viral replicase, polypeptide proteins, PP1A and PP1AB, which are then cleaved into small product by viral proteinases. The polymerase produces a series of subgenomic messenger RNAs by the discontinuous transcription and finally translated into the relevant viral protein. And viral protein and genome's RNA are subsequently assembled into virion in the endoplasmic reticulum membrane and Golgi, and then transported via vesicles and released out of the cell and infect other cells. This is the schematic presentation of the life cycle. The coronavirus bind with the ACE2 receptor and enter into the host cell, and here it transfers the genomic content, and it will affect the messenger RNA, Golgi, and endoplasmic reticular membrane. Then it will affect the RNA, and then it will reassemble, and then it will release out of the cell, right? So this is the pathway through which the virus will go into the cell, affect the RNA, genomic content of the cell, and then it will come out from the cell. If you see the pathogenesis after, say, if the person is infected with the COVID-19, then he will be having the decrease in lymphocyte count and significant elevation of the neutrophils. Meanwhile, inflammatory markers were markedly elevated, including C-reactive proteins, ferritin, interleukin-6, IP10, or this TNF-alpha, then reduce the lymphocyte count and elevated level of the ferritin, interleukin-6, and D-dimer. This is how the drug is different drug, or where we can, or pharmacist can, some activation of innate immunity in the lungs or adaptive inflammatory response. So here we can work, we can have anti-C3, anti-C5, anti-leukin-6 or anti-INF. These component we can have, and we can overcome with the situation. So scientists has to work on these parameters. This is again the schematic representation of the drug for COVID-19 with their mode of action. So different drugs which are where they are acting, say arbitol acting at this target of S protein and AC2 interaction. So arbitol is acting and preventing the interaction of the SARS-CoV-2 virus with the host cell. Then chemostat mesylate inhibit the TMPRSS2 and prevent viral cell entry. Okay, so these are the different how the these are different chloroquine. These inhibit viral entry and endocytosis by multiple mechanisms as well as of the immunomodulation effect. So what is the WHO verdict on novel coronavirus 2? When we keep our hands clean, we keep ourselves safe. It was said by the WHO. If we keep our hands clean, we can ourselves safe, and we keep others also safe. In this address to the closing event, WHO Director Tedros said that the ultimate measures of success will not be how fast we can develop tools. It will be how equally we can distribute them. Nowadays, this point is very important. If we are able to, if we develop vaccine, but it depends how fast we distribute it to the our peoples or citizens of different countries. That is very important. And for the distribution of the vaccine, pharmacists play a very important role. None of us can accept a world in which some people are protected while others remain, and they said that it will last long way. It will last long way. We have to keep these things in mind. This will not go away easily. We have to live with this, and we have to, accordingly, we have to change our habits. People have to live with it like HIV all over the world. The COVID-19 pandemic is causing significant loss of life, disrupting livelihoods, and threatening the recent advances in health and progress towards the global development goals highlighted in the 2020. Dr. Tedros, WHO Director General, said, the good news is that people around the world are living longer and healthier lives. The bad news is the rate of progress is too slow to meet the Sustainable Development Goal and will further grow off track by the COVID-19. So in after 2002 to till date, if you see, if you compare the case fertility rate and R value of commonly known virus infections, Or in the last, after 2002, we have three outbreaks, virus outbreaks. That is why the SARS-CoV and MERS-CoV and novel SARS-CoV-2. See this viruses and fertility rate. Novel coronavirus, the case of fertility is 3 to 5%, and RO is 1.4 to 5.5, right? And SARS-CoV, that was originated from South China in 2002. Case fertility is 10 and RO is 2 to 5. MERS-CoV having 40% fertility rate and RO is less than 1. Similarly, swine flu H1N1 0.03% fertility with RO 1.2 to 1.6. And so on. Say HIV is having more fertility rate, that is 80% and 2 to 4% RO value. I told you what is RO value. That is the average number of people who will catch the disease from one contagious person. If you see the global scenario of different viruses, then you will find that SARS 2002-2003, the burden was 8098 people were infected, mortality rate was approximately 10%, and 32 countries involved. And coronavirus, that is the novel coronavirus, which we are facing the problem right now, that is burden 93,164. These are the some, now it is 42 lakhs, right? And that is about more than 3 lakhs, right? And if you see the seasonal flu in 2017-18, 45 million were affected, and 61 deaths were reported. The seasonal flu. Now, why India is relatively spared with novel coronavirus 2? That is because of a limited number of travelers. We are having limited number of travelers. That is India and China, if say the habitat for 37% of global populations, and predominant vegetarian population. We have, this is the major cause by which we are not having much cases. That is a predominant vegetarian population. Predominant non-vegetarian are very uncommon. And a limited consumption of deeply fried and roasted non-vegetarian food. Predominant use of fish and chicken, because they said that viruses are, major source of viruses are fish and chicken. And improved weather conditions. We have relatively better weather conditions, excellent government response. You have seen that our government has responded immediately when some cases are reported in India. Also detecting fecal sample and anal swabs, also through the contact and fomites like non-living objects. This is, our government has given the different mode of transmission of the coronavirus to that by sneezing, coughing, or by the infected person, infected droplets, right, that is in the air, infected droplets get on your hands, right, and when touch any surface or persons who are infected one, virus will be transferred if we touch any infected person, say infected person having the virus, hand is having the virus, if we touch his hand, our hands will be infected. Then sneezing, coughing by infected person, then infected droplets get on your hands and virus transfer. So there are different means by, generally if we see the transmission of this coronavirus, it is by the infected droplets, right? If we sneeze, if we cough, then infected droplets come out from the infected person, and sometimes it will catch, if the person is nearby the infected person, he may be infected. So that is why to prevent the spreading of this coronavirus, you have to keep distance of 2 gauge or 6 feet. These are the symptoms. We have already told that after the infection, we'll have the respiratory system like sneezing, running nose, sore throat, dry cough, shortness of breath, and it is also, and we have a fever and fatigue also, right? As soon as one is infected, then we'll have fever, fatigue, and sneezing, dry cough, right? It is also affecting the kidney function, right? It is causing the diarrhea, and it is decrease the white blood cells in the circulation. Say severe acute respiratory illness, that is a SARI, and is COVID-19. A patient with acute respiratory illness, regardless of its severity, who had exposure to any one of the following in the last 15 days will have COVID-19. Close physical contact with the confirmed symptomatic case, healthcare facility where the hospital associated novel with the novel coronavirus infection have been reported, right? Healthcare association associated exposure, direct patient care or working with a healthcare worker infected with a novel coronavirus, or visiting the patient or staying in the same close environment of the novel coronavirus patient. So it will be infected by this healthcare associated exposure of to the healthcare workers also, working together in close proximity or sharing the same classroom environment with a with a novel coronavirus patient. Traveling with a novel coronavirus patient, living the same household as a novel coronavirus patient, severe acute respiratory illness, or patient having fever or nasal temperature over 38 degrees centigrade or 100 degrees Fahrenheit, then this will be the positive case of the COVID-19. Cough is last approximately 10 days, which requires hospitalization. Prevention, as it is said, that prevention is better than cure. We must have to clean our hands with soap, water, alcohol-based hand rub. We have to cover our nose and mouth when coughing and sneezing with a tissue or fixed elbow. We have to avoid contact with anyone with cold or flu-like symptoms. Avoid contact with those who show sign of flu. Avoid unprotected contact with the live, wild, or farm animals. Thoroughly cooked meals and eggs. So by these means we can prevent the spreading of the coronavirus too. Hand hydration, the guideline is provided by WHO on hand hygiene in healthcare. That is, it indicates that before and after any direct patient contact, we have to wash our hand with the alcohol-based hand wash, or we have to wash our hand in between the patient where or not gloves are worn, or immediately after the gloves are removed, we have to wash our hand before handling any invasive devices. Again, we have to wash our hand after touching blood, body fluids, secretions, excretion, non-intact skin, or contaminated items. Even if gloves are worn, we have to wash our hand during patient care when moving from contaminated to the clean body site of the patient. Again, we have to wash our hand after contact with inanimate object in the immediate vicinity of the patient, again we have to wash our hands. Generally, microorganisms on hands are survived 60 minutes. So we have to frequently wash our hands. There are some hand sanitizer, alcohol-based hand sanitizer. They are the best one, and antimicrobial soap. They are better, and soap also a good hand sanitizer. Say now how to wash our hand. That is very important, and we have to know where our, if we normally wash our hand, how this which area of our paw will be unwashed, right? So we have to see this uh, figure. The red one is the area most frequently missed during the washing. These red one area when we normally wash, right? And blue one is the less frequently missed area, and the this yellow one is the not missed area. So if we normally wash, if we do not use the technique given by the physician or the WHO, then our hand will not be clean. We will think that our hand is clean, but it will not be clean. So we have to follow the procedure of washing. These are the different steps by which we have to wash our head and remove the any contamination that is on our hand. Say rinse the hand with the water first, then use soap, right? And palm to palm, rub it palm to palm, right? And then on the back. Then on the back, rub on the back with the hand, and then both of thumbs. And you have to rub the thumbs with the another hand, both the thumbs to be clean. Then finger on the back side. On the back side, you just cross the finger and rub the finger. Finger interlocks, right? Then wrist, you have to clean the wrist and fingernails by rotating the nails with your palm, right? Frequently rotating with the palm. So this is the procedure by which we can remove most of the contamination which is present on our hands. Say, 5th May was celebrated is the Hand Hygiene Day. And WHO has explained how to clean your hands. The question that we discussed that was given by the WHO. Now, another way, you have to wear the mask. Now, there are two types of the masks available in the market: surgical mask, normal regular surgical mask, or the N95 or N99 mask. Now, can we wear a medical mask to protect against new coronavirus? I think no. Surgical mask will not protect ourselves with the coronavirus, because it simply block liquid droplets only. Don't offer full protection against the airborne virus, and don't fully seal off nose and mouth, because if there is space near nose and mouth, then this virus will be transmitted. Where our eyes remain exposed. So surgical mask is not good for preventing or protecting us with new coronavirus. This is N95 and N99 mask. This is the perfect mask by which we can protect ourselves with the novel coronavirus. This is N95 face mask. So it is having the ability to filter out oil-based pollutants, more efficient, but it is more expensive because it is having very fine pores. and using the membrane filters, so have to be replaced, and these must have to be replaced after approximately 5 hours, 50 hours of uses. Regarding the treatment of this, so far there are symptomatic treatment and no specific antiviral therapy is available in the market. There are some repurposing antivirals that are using for curing the symptoms, and therapy in the vaccine is still in embryonic stage. So treatment approach is inhibition of SARS-CoV-2 fusion entry. As I said, we can inhibit the fusion with the ACE2 receptor, or disruption of the SARS-CoV-2 replication, or suppression of excess inflammatory response, or coalescence plasma treatment. These are the different antiviral medicines they are used, right? And some anti-malarial drugs, chloroquine, hydroxychloroquine, they are used, right? Azithromycin also be used for treating the symptoms. And commonly used therapeutics are lopinavir or ritonavir, or combination of lopinavir or ritonavir are used. Hydroxyquinoline is used. Azithromycin is used, or in severe cases, combination of hydroxyquinoline or azithromycin is used. And in some cases, plasma therapy is also giving good results. Now the pharmacist, how the pharmacist play important role to overcome this COVID-19 problem. Say the pharmacist, as we are the most accessible healthcare providers, because we are in first touch point of the patient. And any patient or person come, first it will go to the medical store and ask for the medicine. So the first point of contact is the pharmacist. First-hand information provided in rural and underserved communities. He is providing the information to the patient, right? Whether it is the rural or sub-suburban communities. He is the only person which is providing the information. Caretaker of medicine and vaccines, how to store that medicine, how to take that medicine. He educates the patient how to take that medicine, how to keep that medicine, how to keep that vaccine, right? How to use that vaccine, how to inject that vaccine. Stockholder of desired medicine and vaccine, if there is no legal barrier, may be trained for infectious diseases, right? You have to think about this. If the government allows pharmacists to initiate antiviral therapy in coordination with the physician, then pharmacist can give this antiviral therapy if the government is allowed. So we have to see that our limitations, and this our limitation, how can we help our people, how can we help COVID-19 infected peoples. Say, role of pharmaceutical in this pandemic COVID-19 situation, to reduce the burden of patient on the hospital as well on the clinician and physician. Community as well as the hospital pharmacist can contribute in many ways, as they are first help provided to the society. Say, if we see the community pharmacies, in outbreak affected and unaffected area, as you know, that we are the first point of contact with the health system and patient, provide of need-based information and reliable advice for achieving high-level immunization in case of availability of vaccine. We can provide, if the government permits, right? Then or government can use our services for immunization purpose also. If they are authorized for testing, this is also very important. If pharmacists are authorized for testing of other infectious disease with the similar symptoms that could be mistaken for COVID-19, if the patient is not having COVID-19 and he is reported that, and he has to be tested. Then, and he may be allowed to start a point of care testing center, POTC, for testing. Hello, how much time is left?
Sir, time
For testing infectious diseases, which will reduce the unnecessary burden on the clinician and physician. So, if the test 10 minutes, 10 minutes.
Yeah. Continue, sir.
Within 10 minutes. Okay, right. So, well, if the authorities allow us for testing the this infectious disease, we can open testing centers and where we can test the infectious disease and reduce the burden, unnecessary burden on clinician and physician. So POTC will reduce the unnecessary burden on clinician and physician. Only those patients who are needing higher help for care will be referred to their physician or hospital for treatment. So community pharmacists can share responsibility for ensuring adequate storage and supply of appropriate stock of pharmaceutical products, devices, such as medicine, masks, PPE kits, right? And in such a pandemic situation, informing and educating the public regarding the COVID-19 and coronavirus, counseling the public and patients. Hello, is it okay? Referring the patient for specialized physician, promoting disease prevention and promoting infection control. In addition to COVID-19 related roles, pharmacies provide an essential public service to the whole population through the supply of medicine and pharmaceutical care. Now, the hospital pharmacists are also playing a vital role in outbreak and outbreak affected and unaffected areas, such as, again, it is ensuring adequate storage and supply of appropriate stock of relevant medicine and other medical products or devices, collaborating with the healthcare professionals, doctors, in providing patient care and support. We can promote hospital for prevention and control of, we can help rather hospitals for prevention and control of infection, informing and counseling the patient before coming into the hospital, or if they are in the hospital, we can counsel the patient, ensure the responsibility use of the pharmaceutical product supply, we can educate them how to use it, and the patient should be responsible for taking this medicine, the way of taking the medicine, we can educate them. For example, ensuring the healthcare profession, being in the case of the COVID-19 situation, how to wear the mask appropriately and know how to take them off correctly to avoid contamination. We can educate the healthcare professionals also. Pharmacovigilance and monitoring the treatment outcomes also. We can keep record of all these medicines or medical devices in such a pandemic situation. During the pandemic situation, this is very important. We have to, in addition to community pharmacy and COVID-19 rules, our pharmacy provide an essential service to the patient, both inpatient and outpatient, and healthcare team through the supply of medicine and pharmaceutical care. The role of pharmacist, the entire pharmacy team should be trained for technical and scientific information on affected area. They are required to be updated with the figure of number of confirmed cases per country. They should also visit relevant authentic web pages for information collection, information on prevention measures, including information on disinfectant, proper hand sanitization, if necessary, face hygiene. We can educate information on how to proceed in a suspected cases, including strategies that each pharmacy should implement, material available to support the intervention, the information brochure, intervention flowchart, and accurate information website. So these are the roles of our role in this pandemic situation. and obviously there are possibility of exposure of frontline pharmacists to COVID-19 exists because they are interacting with the patient who are possibly infected. Therefore, healthcare workers should take measures to protect themselves as well. Right? So during whole process, we have to take care of ourselves also. We should not infect with the coronavirus too. Now, post lockdown in prevailing COVID-19 situation, after the lockdown ends, we have to be more careful because we will not be knowing who is the carrier of this coronavirus and may infect you. Also that we must have to take all the precautions which we are taking during the lockdown. So all the precautions which we were taking during the lockdown, same precaution we have to take after the lockdown ends. People should understand their responsibility. They should be educated with the COVID-19 situations, keep social distancing at every places of the lockdown ends. Regular sanitization is required. Everyone should wear mask to prevent. Yeah, now this should come in your now lifestyle. It should become your lifestyle. Everyone should wear face masks to prevent spreading the virus through the coughing and sneezing. Frequent disinfectant the working places frequently with proper disinfectants like 1% sodium chloride solution or any phenolic solution as given by the WHO. All worker, employees, officer, student must be thermal screened before entering into the office or classroom. Keep records of every employees or student who are coming from other infected places. Meeting may also be organized using video conferencing or mobile apps. Use virtual mode of teaching and learning. Also, the citizens should be asked to use Arogya Setu app as recommended by our government. Thank you very much. So it is the according to WHO, we have to support it in this COVID-19 situation. Support it to those who are infected. Be careful so that you will not be infected. Be alert so that you will not be infected, and be kind. So you have to help whatever help you want to give to the COVID infected people. You have to give. Right? Thank you very much.
Can we start now?
Yeah, you can start.
Okay. Thank you so much, Dr. Alok Mukherjee, for giving me this opportunity to speak. And Dr. Sanjay Jain, Professor Sanjay Jain has very nicely set the pace for this COVID-19 scenario. And I will take up from where he left off. Basically, there are a lot of significant gaps and challenges when there is a global pandemic, and we are definitely not prepared for something like this because it comes all of a sudden and new challenges are thrown up. So how we respond to these challenges, we are often unable to meet even basic requirements. So trying to meet up with these basic requirements, a very good tool that we can have is 3D printing. And that is why I'm going to talk on 3D printing and its relevance in this COVID and post-COVID era, how we ought to be geared up for such challenges in the future as well, and what we are doing right now. That is what I'd like to share with my audiences. This is my university, which is a central university in Lucknow. So full credit to them for supporting this venture and leading us into intellectual pursuits such as this webinar. So basically, what is 3D printing? It is just three-dimensional printing, which means manufacturing method in which objects are made by either fusing or depositing material such as plastic, metal, ceramic, powder, liquids, or even living cells in layers to produce a 3D object. We are all used to a 2D printer wherein the dimensions are length and breadth. In a 3D printer, we have a third dimension that gets added on, which is height. So this 3D printing is also called additive manufacturing. If we were to manufacture from a big block, just like somebody makes a statue out of a marble block, what is the person doing? He is subtracting. There's one big block and he keeps chipping off little pieces from the statue and making the statue. So that would have been subtractive manufacturing because you're subtracting from the block. Additive manufacturing means you are building up layer by layer. That is why it is also called additive manufacturing. It is called rapid prototyping because whenever you want to make a small prototype fast, what you can do is use this equipment of 3D printing, therefore the name rapid prototyping. One more name that is given to this technology is solid free form technology because you can make any sort of a free form from this technology. So these are all synonyms of 3D printing which you can have. So the basic setup in a 3D printer is a CAD file which you need to build and a print head which will first move around the XY axis. So just like your 2D printers, they move around the XY axis. That is how this 3D printer will also work. And then the printer will start moving on the Y axis to build layers vertically, layer by layer on the XY plane. So you have an X plane, a Y plane and a Z plane. Now you can have two-dimensional radiographic images such as X-rays, magnetic resonance imaging, computerized tomography scans. All these various scans that we have, images that we have, which are 2D. These can be converted into 3D print files and they allow the creation of complex, customized anatomical and medical structures which can be added. So over here you can see a radiographic image which can be converted to a 3D print file to create a complex, customized anatomical and medical structure. So over here you can see these various points that have been identified on this vertebrae, and this is something which they are trying to 3D print. This is a video demonstration of how things like tablets can be made. This was the first tablet that was made with the help of 3D printing. And let me see if I can play this YouTube video for you. This is the printing of a theophylline tablet, the 3D printing of a theophylline tablet. Over here you can see the XY axis is moving up along the Y axis. First of all, they define the length, the breadth and the height along which the 3D printer is going to work. The material, the printing ink is what you require when you make your tablet. So it is going to be a polymer and your drug, which is going to be the printing ink in this case. You can see the XY axis moving up, and now the printer will start making the tablet. So you can see the printer moving around in circles as it prints one layer of the tablet, and then layer by layer it keeps increasing. So over here now I've already described it to you, but very quickly we can see this video how the 3D printing is happening. So you can see the 3D printer, you can see the XY axis, this is the Z axis that we have over here. So these are the spools. This is from where the printing ink will come, and now you can see that the printer has started making It is first measuring the XY axis, it comes back, and then it starts making the tablet. So the tablet is now getting made layer by layer. This is why it's called additive manufacturing. The tablet is getting printed. So this theophylline tablet has been made. And you can see that now hand comes out, picks up the tablet. This is the finished product that we have. Okay, so we are back to the slide where we were. I hope you all can all see it.
Yeah, it's okay.
Yes. Yes.
Now we can.
I will now switch to full screen so you can see it properly. Okay, so what is happening right now in the COVID area, that's important to us. What has happened is there is a 3D printing community that has come together. So all the people who had 3D printers, they have very rapidly come together. They have created websites where you can share the repositories, you can share the 3D printing designs, so that rapid response to this pandemic can be made. What exactly, where exactly do we need this response? The three most commonly used 3D printer technologies that we have are selective laser sintering, thermal inkjet printing, fused deposition modeling. At the moment, I don't think these models are important to us. However, we just need to know that these are the common ones. What is the benefit? Customization and personalization. What is it that exactly we want? What are we falling short of? That can be done with the help of 3D printing. So definitely this made to order fixtures, etc., that can be made, that is the advantage. The customization and the personalization definitely is an advantage of 3D printing. So all over the country, and in fact all over the world, doctors and nurses, they are engaging in crisis management. They are trying to make the most out of the meager resources that they have and that are available. Many hospitals are at the risk of being overrun with COVID-19 cases. India has crossed 1 lakh. The situation is definitely scary, but by now I think we have got enough time to be prepared. We have also got enough time to educate the masses on how they need to help themselves. Okay, so what is the 3D printing community doing to help to flatten this curve and not make it peak, so that whatever requirements that we have fall short? That is something which should not happen. Okay, so one of the greatest issues is the lack of ventilators that are necessary to treat COVID-19. But 3D printing technology has significantly impacted the ventilator shortage, as many of the vital parts can be fabricated using a 3D printer. In 2017, it was predicted that US dollar 0.84 billion is the required market, medical devices 3D printed market. And in 2022, it was predicted that it is going to rise up to 1.88 billion US dollars. This was in 2022 that they said it would reach this much. Who had anticipated that something like COVID-19 is going to hit us out of the blue like this and change the entire scenario? What was predicted in 2022, probably now this has shifted and it has come in between, somewhere between. I mean, it is now 2020 that probably we are hitting this market. So this was how the 3D printed market was increasing. But the data of 2020 is now going to be somewhat what it would have been in 2022. There are three ways that we can utilize 3D printing. One is medical devices that we can make through 3D printing. The other is biologics that we can do with 3D printing. And the third is drugs, which we can make through 3D printing. So these are three huge, significant areas of 3D printing which we can use. These are the components of 3D printing that are often required. So we need equipment, we need the printers, sometimes we need bioprinters, we need materials, then we need different types of polymers, sometimes we need metals and metal alloys, we need biomaterials like cells, maybe ceramic, paper, wax. Of course we need software and services, and we need people who are trained in 3D printing. The question I'd like to put to my audience is that all of us have 3D printers in our syllabus, especially in the Pharm syllabus, we have 3D printers. But how many of our institutions have 3D printers? How many of us are exactly using 3D printing? So the need of the hour is that 3D printing should definitely come to the forefront now, and it should be taken as something which will meet the challenge, or it will meet the existing challenges. While I continue talking. So what are the different types of printers that we require? Electronic beam melting, laser beam melting, direct metal laser sintering, selective laser sintering, etc. These are the various technologies that can be utilized for 3D printing. What can be made with the help of 3D printing? We can make surgical guides, dental guides, cranio, maxillofacial guides, orthopedic guides, surgical instruments, retractors, scalpels, surgical fasteners, prosthetics and implants, standard implants, customized orthopedic implants, customized dental implants, customized craniofacial implants, and tissue engineering products. So this is only to tell you that we are not limiting ourselves only to COVID. There is much more that can be done with 3D printing. I told you that now there is a 3D printing community. So this central hub which connects makers and medicine, there is a public Google Sheet which has been set up to gather makers from all corners of the world to provide their 3D printing services for components like oxygen valves. And there is a submission form available for the makers who would like to take part in this venture. So you can see that the world is getting together and the 3D printing community is getting together to respond to the crisis that exists. So a very good sentence by the Stratasys CEO, Mr. Zeff. He said that be anywhere, print virtually anything. The strength of 3D printing, be anywhere, print virtually anything, adapts on the fly, make it a capability for helping address shortages of parts related to shields, masks, ventilators, among other things. Workforce and partners are prepared to work around the clock to meet the need for 3D printers, material including biocompatible material and 3D printed parts. Also, there is an Italian company which needed oxygen valves. If you remember, Italy was one of the countries which was very badly hit initially by the coronavirus. So in a certain hospital in Brescia with 250 coronavirus patients requiring ventilators, it recently ran out of respirator valves needed to connect the patient to the machines. The original supplier was unable to meet the sudden high demand. So the CEO of Isinova, a Brescia-based engineering firm, used 3D printing to meet the hospital's demand, and through this, patients' lives were saved. What they did was they went about rapidly creating a prototype. Then they tested it on patients successfully. Isinova teamed up with a local manufacturing company, Lonati, to mass produce the valves. The Lunati's SLS 3D printed along with Isinova's 6 in-house 3D printers were put to work, and the Italian duo managed to produce 100 respirator valves in 24 hours. The valves are currently being used to be in the hospital in Italy. This is a photograph of those valves that you can see which were used in the ventilators. So definitely the 3D printing community responded very well to this crisis situation. Now, it is not all so rosy. what are the problems? Why aren't we doing it more if it is so simple that all we need is 3D printers and we can start printing? The problem is in the case of IP infringement lawsuits that will happen because probably that respirator part was something which would be the intellectual property of a certain company. So when somebody else makes it without having the license to make it, that is the challenge of 3D printing. So there's a certain scientist from Shenzhen, China, who has offered to face the IP lawsuits on behalf of the clinicians looking to 3D print patented components for respirators. So even the lawyer community is helping the 3D printing community because they are helping in terms of prices. So low-cost ventilator which does not use electricity to function. Especially in a country like India, we have a number of places where power failures are a big problem. In the villages, there could be villages which may not have power for 24 hours. When this disease reaches places like that, what will happen to patients if at all there is a ventilator and if there is no electricity, what is going to happen? So there is a team from the Oregon Health and Science University in USA which has developed a 3D printable low-cost ventilator. The design is reportedly so simple that it does not require any electricity to function. It only requires oxygen from standard tanks available at most hospitals, and this can be replicated worldwide for US $10. So it sounds really amazing, and if indeed it can be replicated, I think that it should be done so that we are prepared for what is coming on in the near future. So this is that ventilator which does not require electricity and operates off a standard oxygen tank. So I think that this university has done a wonderful task in making these. Now there is another firm which has bioprinted lung tissue to accelerate COVID-19 research. So 3D printers, they do not just make valves and respirators, they also can make lung tissue. So we also have bioprinting going on through 3D printers. So this firm, they expect that 3D bioprinted and other 3D tissue models made with lung cells, including a patient's own cell, will be used as a clinical trial in a dish, and it will enable quick testing of potential COVID-19 therapies. Despite the various existing methods of testing respiratory viruses in vitro, we require a more effective platform for testing. This was said by a professor at the Department of Pulmonology at Seoul National University in Bundang Hospital. The creation of precise artificial respiratory models through 3D bioprinting technology offers a potential of alternative. Okay, so this is the kind of respiratory epithelium cells which are being 3D printed, and whenever you print, or let us say you multiply cells in a petri dish, what you get is 2D. But if you do it with the help of a scaffold, what you get is 3D. Once you get it in a 3D form, it is more realistic. You can call it not just a cell line, you can call it a tissue. So a bioprinting company called Glycel has announced the development of lung epithelium tissue for COVID-19 research and vaccine development. This is a 3D printed face shield that is being printed. I think that you must have seen these people using them. Some people even made it with the help of transparencies. These are definitely required, as Professor Sanjay Jain was just saying, that simply putting a mask may not help at times. So especially these frontline healthcare workers, they need to be really well protected because they are handling cases which are definitely virulent, which can definitely spread the virus. So for their protection, they first need to put on goggles, they need to put on masks, and after that they need face shields as well to protect themselves, which can easily be printed with the help of 3D printers. The health crisis caused by COVID-19 has led to emergency solutions that under normal circumstances would not be considered. So One such approach is the conversion of a French sportswear and goods manufacturing company, Decathlon. Many of you may be familiar with the name Decathlon because they have got stores in many cities in India also. What they did was they converted their snorkeling mask into an emergency last resort respirator using a 3D printed valve. So snorkeling is a sport which requires a mask because then when people go underwater, they need oxygen. So this snorkeling mask with the help of a 3D printed valve was also converted into a respirator. More than 5,000 pairs of 3D printed safety goggles have been fabricated and donated to Chinese hospitals till date. That has also been done through 3D printing, and the Chinese enterprise are ramping up their facility. Over here you can see a person wearing 3D printed gloves, 3D printed goggles and a face visor or a face shield to protect. So he is wearing a normal mask, I think, but he has a face shield and goggles on, and of course gloves, which are all 3D printed. Okay, now here's another development. Probably we would not have reached this far in our thoughts, but 3D printed quarantine rooms, which means the sky is the limit. You just have to think up the design, get the material together, and you can print what you want in an emergency situation. So we also have 3D printed quarantine rooms. Testing swabs. Now, testing is being ramped up. It is being stepped up in all parts of the country, and especially the states like Maharashtra, Gujarat, Tamil Nadu, where the cases are increasing. Government is very rapidly responding to the situation, and it is trying to ramp up its testing so that they can identify the patients and they can quarantine them in such a way that these do not spread the disease to more people. And for that, what is required? Testing swabs are required. These swabs, you can see one here, these can also be 3D printed. So Pharm Labs is mobilizing its community of users to develop nearly 1,000 printers to quickly mass produce these swabs, as well as other important personal protective equipment, PPE that they are called. So a single print can produce 300 test swabs at a time, enabling Pharm Labs to produce 75,000 to 1,50,000 swabs per day. This development will rapidly provide hospitals with access to large quantities of these essential COVID-19 test kit components. Here is a 3D printed ventilator, which was made by this team that you can see over here. And CEO Lorusso has received dozens of requests for help for critical components. What they are doing, they are supporting everyone for free. More than 25 machines in all their building have been working day and night to provide all the support for the emergency of COVID-19. And they are saying that anybody can contact them and they will help out if they can. This is a 3D printed component which has changed or converted an existing manual ventilator system into an automatic one. This photograph is courtesy UC San Diego. Okay, in UK what is happening? The UK's Manufacturing Technology Association has provided an update about how significant UK industrial technology and engineering businesses from across aerospace, automotive and medical sectors have come together to produce medical ventilators for UK, and 6 UK based race teams are also involved in this push. They are also helping to make what they can. UK's Paragon Rapid Technologies, they have also got together and they have designed from carbon 3D printing face shields for their frontline workers in hospitals. Similarly, Proto Labs 3D printed 3,000 parts for ventilator manufacture. Now over here you can see an intubated patient who is using a respirator which was made with the help of 3D printing. So these parts are definitely working, and this entire ventilator has been 3D printed and it works. Okay, so now what is the US FDA doing and how are they allowing what can happen? So the question was that how does US FDA allow? And the answer is they recognize that when conventional products are unavailable, some entities are considering printing or purchasing 3D printed devices. So the FDA recently authorized an emergency use authorization for ventilators, ventilator tubing connectors and ventilator accessories, which could include items such as 3D printed tubing connectors for multiplexing ventilator use. What is multiplexing ventilator use? Very often, more than one patients are connected on to a single ventilator. So this can be done with the help of multiplexing ventilator use. So if US FDA is allowing it, definitely the Indian agencies can also do so. So what is happening in India? Till now I was talking about Italy and UK and USA and Europe. So where is India? We are there. We are definitely there. So universities turn to 3D printing for COVID-19 gear. This is the headlines of a newspaper article on April 29, 2020. Several universities and institutions across India are now using 3D printers to make face shields as well as ventilator splitters. I hope all of you can hear me.
Yeah.
Okay, so Divide by Zero Technologies, a Navi Mumbai-based manufacturing of industrial 3D printers, is in an overdrive to produce face shields to protect healthcare workers on the front line from potential COVID-19 infections. Now this Divide by Zero, DBZ, it has so far supplied 700 3D printers, mostly in India. This firm started in 2013. And suddenly when this COVID-19 started, the owner of the company, Mr. Swapnil, he started getting calls from a team at IIT Bombay and also his clients like Tata Motors asking whether he will be able to assist in building ventilators, face shields, UV sterilization robots using 3D printing. So what Swapnil says is that after the COVID-19 crisis, 3D printing will never be the same again. Mumbai-based Boson Machines, a 3D printing startup, has brought out a protective face mask that can minimize the risk of infection among on-duty medical staff while they take care of patients. So with the help of Swapnil Parekh of Jaslok Hospital, Boson Machines has designed a face shield of two components. What is important for all my pharmacy students who are online is that you need to understand that very simple components are required to make these. A plastic helmet which is made of polylactic acid and a 0.4 mm transparent sheet made of polyvinyl chloride. So PVC and PLA are something which I think that every pharmacy lab will have. So it is no big deal. All you require is the 3D printer. All you require is the scheme with which you can work, and this can be done. So what is India faced with? The harsh reality is that the country has only 50,000 ventilators, which will not be enough if COVID-19 cases grow. What do we have to do? Okay, so there is a Bangalore-based tech startup, Ethereal Machines. They have created these ventilator splitters using 3D printing. They have already tested it at Aster Hospital in Bangalore. And the splitter can split the supply into a 50-50 ratio to provide oxygen from one source to two patients. In case when one patient's condition is worse than the other, the startup has created a differential ventilator splitter which can split the oxygen supply into a 30-70 ratio. So, which means there is some amount of flexibility also within the system, and these splitters can be customized according to the use or the condition of the patient. And these splitters are definitely something I feel that every hospital in the country should be supplied with, so that they are ready for any case of emergency. God forbid. Hopefully it should not happen, but if it happens, we need to be prepared with these ventilators, or maybe we should be prepared with those low-cost ventilators which were supposed to be $10. So if we can start printing those as well and supply them in cases of emergency. Maybe we should also be prepared for the ventilators which do not require electricity. So this is the response which we as pharmacists are responsible for, that we should be doing. because medical devices is definitely also a part of pharmacy. Somehow or the other, we have underplayed it because we never imagined that a situation like COVID-19 pandemic will hit us. But now that it has hit us, we should never be as unprepared as we were this time. We should always be prepared that if something of this sort happens, how are we to rush in case of a medical emergency and respond? So that is the responsibility that we are faced with. I'll share few more photographs with you. This is Chennai's 3D printing community, which is making face shields for healthcare workers. The same is happening in Coimbatore based company which are manufacturing 3D printed face shields. Now, is face shields and ventilator splitters and masks probably or ventilators themselves the only things we can do? No. We can also come up with pharmaceutical tablets. I already showed you the video of the theophylline tablet. So if in case of an emergency, if we require, we can even personalize or customize tablets, which can be done with the help of 3D printing. For example, a pharmaceutical tablet weighing 10 mg, it can easily be custom fabricated on demand as a 1 mg tablet. Some drugs may also be printed in dosage forms that are easier and more cost effective to deliver to patients. Over here, the only input that you require is that very 3D printer which was already being used. Only thing that you require is a very specific 3D printing ink and you require the API. So definitely it can work very fast, and 3D printing means that a product can be made within several hours. Collaboration is also one thing. You can easily exchange notes with the community and come up with solutions that are required. Bioprinting of organs and tissues is possible. I have already shared with you that this is happening. Okay, so now this is something which I'd like to share with my students. If we have some cells and we have a polymer which can be cross-linked up to a certain extent, if these cells and these cross-linkers, this cross-linker will behave like a skeleton on which these cells can grow. So if you take them together, becomes a bioink. This bioink is put in various different types of printers, and whatever shape that is required, that can be printed. So this is bioprinting with the help of a 3D printer. Organ printing can also be done, although we are in the nascent stages, but organs like bladders, skin, etc., these are already being printed. Only wherever you have vasculature, that is something which 3D printing is at the moment not able to handle, but probably the future we will have solutions. Replacement of organs, which is definitely a big challenge. Maybe in the future we will have working organs which have been 3D printed and which will bring an end to organ donation and the racket that is there behind them, and we will have organs transplanted from the patient's own body. So this is how the organs take place, but at the moment for COVID we are more concerned about medical devices. So you can see any shape, any size medical device can easily be 3D printed. These could be valves, it could be sutures, it could be tubings, etc. Whatever is required, it can be made. See, this is how bio inks, like in a petri dish, when we grow cells, we only grow them simply on a 2D structure. Whereas if we have a scaffold which is made of a biomaterial, and then we can grow these cells in a 3D structure, there is interpenetration network kind of a thing, and that is when it becomes 3D. So the printing ink, it should have print temperatures that do not exceed physiological temperature. There should be a mild cross-linking or gelation condition, and the bioactive components, they should be non-toxic and they are able to be modified by the cells after printing. These are the various printers that are used. I'm not getting into those. This is a 3D printed scaffold for an ear and then the cells that have been grown on them. But at the moment, not for COVID, we need not discuss this. Just to increase your knowledge, we could use tissue models like cartilages, bones, skin, blood vessels, muscles, etc. And using these tissue models and different types of cells like mesenchymal stem cells, chondrocytes, etc., we can then bioprint them, and the bio-ink material that can be used could be PEG diacrylate, algylate, nanocellulose, collagen, agarose, fibrin, etc., and with the help of which we can have different solutions to the problems that arise. This is a YouTube link of a 3D printed heart, but I'm not going to play it at this moment, probably because of the paucity of time. But I hope that many of you have become interested in this topic, and you can go back and you can click on these links, so you can find these links on YouTube and play them. They are very interesting, and us as pharmacy personnel, we have to get involved in this venture and come up with brilliant results. Okay, so we can also have one more solution, anatomical models for surgical preparation. So if there is a patient who needs surgery, and if the physician does not know what is going to be done inside the body, he can practice exactly how he will approach and what he will do inside the patient's body. This can be done with the help of 3D printing. So over here you can see a patient doctor having a 3D model of the patient's heart. They are measuring it and finding out exactly what they will require inside. So this is also one more wonderful application of 3D printing. Over here you can see surgical planning by a neurosurgeon inside brain surgery. Over here you can see a 3D printed representation of an influenza heme agglutinin trimer. So if you can do it for flu, probably you can do it for COVID as well. And then outside you can check where exactly you can block, what you cannot with your drug, because this is a 3D printed representation of the trimer. We can also have drugs which have complex drug release profiles. So that is also one advantage, that you can put multiple drugs into a single tablet, which also leads to better patient compliance. This is a CAD model for a 3D printed tablet. So you can see that it's very smooth and it's very precise. Okay, so we also have 3D printed pyramid shaped tablets. Under our normal tableting machines, to make a pyramid shaped tablet will be tough. But how is it useful? It is useful because it has a peak. So whenever there is a peak, this portion is going to get released first. So there is going to be an immediate release in the peak of the pyramid, and the bottom will give you the sustained release. So various shapes of tablets can be made which conventionally may not have been possible, because we have our dies and punches and we have problems like picking, sticking, mottling, etc., which can happen. So the best shapes normally that we have are either our regular caplets or tablets that we have, but with the help of 3D printing, shapes can be changed to the best of the problem, like how we want to tackle it, we can come up with a shape. So definitely personalization is very well possible with 3D printing. Now another good use of 3D printing, APIs, active pharmaceutical ingredients, can also be made using printers, and scientists working with Howard Hughes Medical Institute have developed a new 3D printer which can synthesize 14 different classes of small molecules using a set of chemical building blocks. So for the pharmaceutical chemists as well, here is something which they can look forward to and come up with solutions. Maybe this is the next generation, and then we will no longer need our flasks and beakers, and maybe we will just need 3D printers to make complex molecules. That is where the future may take us. So entirely new formulations can quickly be made with the help of 3D printing. Okay, so what are the barriers, what are the thorns in this whole process? Despite the many potential advantages that 3D printing may provide, expectations of the technology are often exaggerated by the media, the government, and even researchers. Probably whatever I have been projecting to you may all sound too rosy, but that is why I want to tell you it is not always a bed of roses. There are a few thorns also. So they could be unrealistic projections, and there could be a number of problems that you have till the time that we reach organ printing when it becomes a reality. Safety and security is also an issue because 3D printing has given rise to safety and security issues that merit serious concern. Like there can be illegal printing of items such as guns, magazines, master keys, ATM cards, etc., which can be 3D printed. So that is the flip side of 3D technology, 3D printing technology. Also, intellectual property rights, a major concern for regulators, that when the intellectual property belongs to somebody else, how can the rights be given to someone who has not asked for them, who has not purchased it probably. So that is one concern. So patent and copyright concerns are a major issue. But to conclude with, 3D printing has become a transformative tool. As printer performance, resolution and available materials have increased, so have the applications. Researchers continue to improve existing medical application that uses 3D printing technology and to explore new ones. The medical advances that have been made using 3D printing are already significant, and the more revolutionary applications such as organ printing will need some time to evolve. So the future trends, I think in pharmacy, when it comes to drug, when it comes to organs, when it comes to tissue, when it comes to research, and when it comes to medical devices, everywhere we are going to see 3D printers. So we should very rapidly switch over to this technology and be capable of handling, at least to a certain extent, at least to the extent that we can respond to situations like this global pandemic that we have been faced with. So the 3 R's that we have here are regulation, research, and resource. We have to consider or talk about all 3 of these. These are a few references which I took. And a big thank you to our doctors, hospital staff, nurses, first responders, pharmacists. We are also there. Police, firefighters, delivery drivers, restaurant workers, grocery store employees, truck drivers, etc. And of course our government of India, who is responding very well. So big applause for all the corona warriors. And we should definitely stand behind them and help them in every of their endeavors so that we come out victorious from this awful situation of this pandemic. And a big thank you for your patient listening.
Thank you, madam. Since we are entering in the new atmosphere of this COVID-19, your comments and suggestions will be very useful for us. Please accept our sincere appreciation for the outstanding presentation regarding the printing and its new application for the COVID-19 patient. Your research and knowledge will definitely help for those who are doing research in this field. I'm really thankful for your showering knowledge, and this will completed. Is there any question from audience? If there are any question, you can ask.
I think you can unmute the attendees, so if they want, they can ask questions.
Ma'am, at what extent a virus can mutate?
At what extent a virus can mutate? There is no limit to it. A virus can mutate. I mean, I don't think we have all the answers, especially when it comes to COVID, which is supposed to be a lab-made virus. We really don't know because it is not going to behave like other viruses do.
So, ma'am, that's why this means there is no permanent medicine for the respective disease.
Exactly. As such, there is no medicine for virus. Even the common cold, we do not have a medicine yet. So what we expect are antibody-based vaccines. Vaccines could be the solution, but for an antiviral medication, I think even the common cold, we don't have 100% cure till date.
So, ma'am, for the COVID disease, we can only treat on symptom basis only.
Symptom basis
Or
is
is there
also
any
possible,
permanent
and we need
treatment?
vaccines. We need vaccines.
So, ma'am, how vaccine will work if the
If it is a
virus can
mutant,
mutate?
yeah, if it is a mutant, the vaccine may not work, but then by and large, normally the vaccine remains the same.
Okay,
That
ma'am.
is why
Thank
when
you.
Sanjay sir was telling you about MARS and SARS and so many different types of viruses,
Okay, ma'am.
definitely those are there. Those are there.
Thank you.
Do
Is
I
there
have
any
any
question
other
from
question?
any other audience? So thank you again, ma'am, for
Thank you so
helping to make
much.
us a very successful webinar of this.
Sir, may I ask a question?
Sure,
I'm
sure.
also thankful to Dr. Sanjay Jain for giving us a providing lecture.
My question is that any vaccines are available for
We
SARS
are
and MERS
very
viruses?
thankful.
I'm really not sure because I've not researched on those, but then I think yes. And let us say my dog, he gets a corona vaccine because canines have different coronaviruses. So in animals, coronaviruses already exist and the vaccines are already there.
Ma'am, if the vaccines are available for SARS virus, then it also will act on corona because the corona serves as the 98% similar genome base.
No, but whenever there is some variation, there is a different type of an antibody. And over here they say that 90% of the virus is natural and 10% is man-made. That is the problem because it is not behaving like other viruses.
Okay, thank you, ma'am.
Good afternoon to all of you. Once again, we are welcome you all in this national webinar series on topic oceanic requirement for healthcare professionals post COVID-19. I would like to express our profound gratitude to all the earlier speakers, Professor Dr. S.K. Jain and Professor Sara, as they have given our thought-provoking lectures this morning. We are now starting our second session, and the speaker of this session, Dr. Anurag Sood, who is a specialist of pharmaceutics. He has done his PhD from NIPER, Mohali, having 20 years of experience of industrial pharmaceutical research. His area ties is pharmaceutical product process development and technology, transfer of various kinds of process form, and manufacturing technology, including novel drug delivery system. He is leading cross-functional product development team with successful global regulatory approval and technology transfer for commercial manufacturing of human health and animal drug products. His research interest and skill enhancement in the area of biopharmaceuticals, designing and developing drug delivery solutions, and new pharmaceutical technology. He has published numerous reputed publications in national and international journals. He has 5 patents on his native. Currently, he is working with Zoetis, globally largest animal health product company, as research director, leading the global commercial team responsible for pharmaceutical development for NCAs and their life cycle management product. Anurag is basically based Zoetis R&D at Navi Mumbai. Today, his topic is animal health, industry research, and impact on COVID-19. I'm just transferred this mic to Anurag Sood. Dr. Anurag Sood will present his topic. Okay.
Yeah. Okay.
Thanks, Professor. Sorry, I'm getting back. I'm getting an echo.
Now
Okay, let me try. Can you hear me?
I can hear you.
Yeah, okay. So thanks, Professor Alok Mukherjee, for the kind words and intro. I appreciate the opportunity to be speaking on this webinar series, and certainly I also want to acknowledge Alok and I go a long way back. We graduated for bachelor's and master's degree same times. We were batchmates in Sagar. So another reason for me to feel privileged and good about today that the previous speakers, I know them both personally and very respected teachers when we were in the pharmacy school. So let me first share my slides and see if you can all see it. Alok and others, is my slide deck visible?
Yeah, we can see you.
Great. Excellent. Okay, so I hope everyone had a good break and good lunch. So my job is to keep you all awake, and let's see how much I'll succeed. That will be reflected by any questions that you might have at the end of presentation. Okay, so it was kind of Alok first to invite me, and then also be flexible to accommodate the topic I thought was fit and suitable for me to talk to this audience. So I'm going to talk about the animal health industry and veterinary pharmaceutical research. I would be spending some time in comparing and contrasting the animal health space with the human health space, and lastly would cover the COVID-19 impact. There's some background noise still coming, so I appreciate if those who are not speaking can keep themselves on mute, please. Okay, so
All of you, please mute your sound so we can hear the lecture, which is important for our students and other scholars. Please mute your. Anurag, can you hear me? You are not audible now. Please unmute. Anurag. The sound is not audible.
Anurag sir, please unmute your device.
okay, can you hear me now?
Yes.
Yeah.
But I'm getting echo. Maybe it is better now. Okay.
Is it okay now?
Yeah, now it is better. Okay. So this is the list of my topics I would try to cover. I'll introduce the animal health industry and what is all the industry about, and the research organization, and how the animal health research is similar or different with the human health research areas. Now, I took a little bit of assumption here, and that is purely based on my personal experience. So please excuse me if that's only a perception and not reality. That I feel that there is a bit, lack of awareness of the animal health industry and what goes on in the animal health, veterinary medicine development. So that's why I thought it appropriate to provide that background, a little bit of that background. Just a second. And then at the end, I'll cover the current COVID-19 impact the pandemic that we are all dealing with. So here is the snapshot of animal health industry. What you can see on the left-hand side, this is list of top 10 companies. The company that I work for is Zoetis. So by sales or the annual revenue, Zoetis is the largest animal health company with a total of about $6.3 billion revenue in the year 2019. And then there are a number of other companies, some of those large human health organizations, and they have the animal health divisions, which are reporting their revenues for the animal health, for example, Merck. This scenario might change very soon because there is an impending merger of Elanco with their animal health, which would, once combined, could most likely stand at the number 2 position with almost close to $5 billion of sales revenue. Another important aspect I want to focus and draw your attention to is, so animal health industry, although not so much of visibility in India and in our local context, but globally it is a significant business. And you can see currently it's almost about $50 billion industry and is poised to increase at a very decent compounded annual growth rate of about 5.5% to roughly about $67 billion in next few years. Another important aspect, most of this, or rather 60% of this total market size is coming from the pharmaceuticals, and the remaining is from the diagnostics and feed additives, although the feed additives are actually part of pharmaceuticals, or from a development perspective, they are considered the pharmaceutical products. So almost like 70 to 75% of the whole industry is, or the revenue is driven from the pharmaceuticals. Here is a snapshot of the R&D spending. So various companies that you see here on the left-hand side panel, this is the R&D spend on an annual basis and for 2019 figures. So almost like $470 billion for Boehringer Ingelheim, and for a similar amount that Zoetis spends, and then there is, smaller companies spending investing on the R&D. On the right-hand side, you can see what is the percentage of the total revenues or annual sales that companies are spending. So again, you'll see the range from about 7% to, at the high end, about 11%. Mostly, the smaller companies are able to put in a higher percentage for different reasons. That the percent in absolute terms of the percentage, the numbers are higher for the same dollar amount, but also with their intent of putting more effort in the R&D to bring in innovative new products in market for growth of their organizations. Now I would put the two global largest pharmaceutical companies side by side. So Pfizer on the human health side and Zoetis on the animal health side. And as you can see, Pfizer about $52 billion of sales in 2019, and Zoetis with $6.3 billion sales. Zoetis is almost about 1/8 of the Pfizer from the sales perspective, which is probably almost the same ratio for the number of employees that the two organizations have. But to compare the R&D investment by these two global largest companies in their own segments, so you see that it's almost 1/16 of the investment in animal health by the animal health company. Keep in mind that Zoetis was formerly part of Pfizer Animal Health, and it was spun off as a standalone company in 2013. So although this might seem a bit disproportionate in terms of the R&D investment by these two companies for the size and the revenue, but I'll explain in the next few slides why this doesn't really, although might seem as disproportionate, but doesn't really out of expectation or trend. So let me start with saying that animal health is a distinct industry to justify my earlier statement, and it does differ from human health. And one of the biggest factors why it differs is the complexity of the animal health industry catering to 8 different species versus human health, which is centric on the human species. Yeah. What are those different species? So we are talking of dogs, cats, and horses, which are clubbed into one general category as companion animals. And the second one is what is called as livestock. So they are basically food producing animals, cattle, pigs, poultry, ovine, and meaning sheep, and aquaculture, that is fish. So these are the 8 specific species which are essentially at the center point of all animal health industry, although the animal health products do get used into other species, for example, zoo animals or wild animals whenever needed. However, particularly from a business perspective, the 8 species are the center point. Our world does depend on animals. I think it's very essential for us to understand why I'm saying animal health is so important, and building that awareness is also equally critical. The one reason why I say that is for a population of 7 billion people on this planet, in one or the other way, we are dependent on the products that are coming from animals, either milk or meat or eggs, fish, etc. Important to point out that the total global value of the agricultural output from the livestock sector is approximately about 40%. And there is about 33% of the land which is dedicated or being used for producing feed for the livestock. So that's quite a significant amount of land that we are using, quite a large size of the industry for the large global population. Now look at the companion animals side. So for a population of 7 billion, you can see almost like 350 million dogs and cats in our living in our homes worldwide. That's the population of the companion animals or pets in our houses. If you look at just the America, there are 62% of the houses, so they are a little more friendly and more adopting the pets and keeping their pets and maintaining them as their family members than elsewhere in the world. And there are emerging markets like Brazil, Russia, China, which are growing at a very decent double-digit growth rates, and much different from several other industries and several other regions where meeting that double-digit growth rate is a big challenge. Now let's look at the research areas of interest for these two segments at a very high level. You'll see there are some uniqueness for the human medicine as well as the veterinary medicine, but there are a lot of commonality. So a lot of therapeutic areas which are common for humans as well as for veterinary medicine industries. And some of those are cardiovascular and cancer, immunology, inflammation, infectious diseases, and pain. These are some main key areas which are relevant for human health as well as for animal health. So what it means is that there is a lot of opportunity for the two spheres to be collaborating and interacting with each other to share knowledge and resources for common benefits and goals. If we see the veterinary therapeutic areas, there is a long list, and you'll see most of those are also applicable for human health. All who have the backgrounds in human health or who are studying the pharmacy courses with the human health centric viewpoint would recognize that these are very, therapeutic areas that we all study about. But two specific areas which are quite significant for the veterinary are the antiparasitics. So these are basically the parasites which are either ecto, which means they are present on the body or the external to the animal, and there are endoparasites which are, for example, intestinal parasites or even heartworms, which are common on the animal health side. So there's a huge business which relies upon the antiparasitics, and depending on the effectiveness against different parasites, they're either called endoparasites, ectoparasites, or endectoparasites. Then there's another area of hormones, which are largely for the estrus synchronization, mainly in cattle or ruminants, and so that by virtue or by means of manipulating the estrus cycle in female animals, the reproduction cycle is managed and harmonized. When we look at the dosage forms in the hello. I think I'm getting some background. Okay. So if we look at the dosage forms in the veterinary medicine, you'll once again agree with me that most of the products and types of products that we develop on the animal health side are similar dosage forms and products that are otherwise done for the human health. So routes of administration and types of products, there is a huge overlap for the two industries. And there is also Can you hear me?
Yeah, we can hear you.
Okay. So in all of these areas of dosage forms and routes of administration, there are commercial products and precedents of using long-acting products for meeting any specific delivery objectives on the animal health space as well. Let's look at the top. This is just a compilation of top 400 veterinary medicinal products, and excluding the vaccine products out of the list. There are about 120 products. So this is, in terms of percentage, what type of dosage forms are most common in the animal health space. And what you will notice here, so parenteral solutions are the largest type of products in the animal health side, with almost 19% fraction contribution to the total top 400 products, or rather 280 products. And then at the second number comes solid feed additives. These are basically the powdered premixes, which are drug concentrates and are supposed to be mixed with the feed for the animals and then administered, largely used for the cattle or livestock animals. The number third is, if we combine all types of tablet dosage forms, chewable and the conventional, then it comes very close to the solid feed additive or premixes dosage form, and that's the third largest type of dosage form popular or used in the animal health space. Then there are topical products, solutions, sprays, and those are called spot-ons or spore-ons, depending on the volume of topical administration. So those are the fourth largest. And then you'll see there are a number of other types of innovative products and dosage forms that are commonly used in the animal health space. One thing that is not so common is the use of capsule dosage forms, and for the reason of in companion animals, the objective is to have the animals take their medication as a free choice, and rather than force feed the medication. So capsules are not so popular or amenable for companion animals to ingest without chewing, and as soon as the capsule integrity is broken in the oral cavity, several aspects of the capsule providing the taste masking or the preventing the drug from the oral release is lost immediately. So that's not so popular, but there are several other types of routes of administration dosage forms which are common. Now, if we look at the what are the most significant unmet needs in both the spaces. So on the human health side, we all are aware cardiovasculars and cancer therapeutics are the most high value and volume therapeutic areas. Then comes the immunology and inflammation, infectious diseases, and certainly one of those that we are currently fighting for. And there is a huge business or the product volume for neurosciences and pain. Now there is some overlap here on the veterinary side. So you can see infectious disease, very common with the human health side. There are sometimes common pathogens, but often not. So earlier you would have heard from Professor Shubhni Sraf that there are coronaviruses in the animals, and there are antivirals or the vaccines available for those type of viruses. However, those viruses which are transmitted and infect the animals do not infect humans, and I think reasons can be very easily understood from the earlier presentation from Dr. Sanjay Jain. Then other than that, for companion animal space, pain and inflammation, allergy and dermatology are the two important areas. Parasiticides, as I explained earlier, particularly ticks and fleas and heartworms in companion animals is an important area. And for livestock, the animal farming, those who are the farmers who are into the animal farming, the livestock performance is the important area. So these are some of the key areas of R&D investment and is driven by the unmet needs in the areas. Now, if you want to understand my earlier statement that when I said that animal health is somewhat similar, you saw the similarities in last two slides, but it is also different, somewhat different from the human health research area, and next few slides are dedicated to that. And you'll understand and appreciate that based on when we try to understand the cycle of R&D investment. So, how does that happen? So the research is fueled by the innovation brought out of the research and the social and the commercial value of those innovations that feeds into the further investment into the research. So when we, in next few slides, when we look at the cycle time, product margins, and the development success of developing the pharmaceutical products in animal health, we will be able to see why I'm trying to impress upon that the animal health R&D is a bit different from how it is done on the human health side. So you can see this is a general slide. It talks about the research phase of the pharmaceutical development, how the research phase is carried out. So starts with the disease target identification, where you're trying to understand the biology of the disease, etiology, biology, and biochemistry involved, and what are the targets. Then you start making some molecules and try to identify something that would act upon those targets and interfere in the biological or biochemical pathways which will produce the beneficial or intended result. Of course, there is a lot of biology and other allied chemistry and other allied fields which are relevant during this phase of the development. And then comes the lead molecule optimization. So once you have identified the skeleton of the molecule, then you try to optimize it to get the maximum benefits in terms of the efficacy and balance the safety risks to the minimum possible. Overall, the pharmaceutical industry on the human health side basically leverages the competitors and academic and government research for the disease target and molecule identification space, whereas animal health more relies upon the lead molecule identification and optimization space from the human health pharmaceutical companies and competitors. So there's an overlap. However, the focus or the area of emphasis is a bit different for the two organizations. Now let's see from the research phase that I explained to you in the previous slide. So on the human health side, there is a need for narrowing the development candidate molecules using alternative species before getting into humans. We all know the preclinical phase that is necessary before we get any drug candidates evaluated in the humans. Disease models may or may not always translate to humans whenever animals are used for preclinical work. And extensive tox evaluation is done in different species, alternative species, which, can you hear me?
Yes, sir, we can hear you.
Okay. So yeah, lots of safety work or tox work is done in the alternative species and not really done in the humans because of the toxin implications. So that's something different in the animal health. So we can get into the target animal species right from the word go and develop our candidate molecules and optimize the molecules using the data that is generated in the target species itself. And whether it is efficacy or toxicology or the safety aspects, those are all studied in the animal health, in the target species. So what that basically means that in the animal health, the research phase is significantly accelerated because now you have a much shorter timelines for developing and optimizing those candidates into the research candidates. Let's look at the development phases. Once the research is over, then it gets into development, preclinical and phased manner approach for the clinical work on the human health side before the product can reach the registration phase. And we all are aware of these phases, and the probability of success in different phases. So you can say, as on the human health side, you start with as low as 0.1% of success rate and eventually grow to a much higher, 75% in the registration process. And even at that stage, a lot of candidates fail, or the filings fail or get rejected because of one or the other issues. We're not getting into that for today. But when you look at the duration, again, it takes a long duration for developing these compounds for each phase and on the human health side. But just like the research phase, the development phase on the animal health side gets accelerated simply because we can get into the target species early on, and we can carry out that development phase very quickly as part of the research phase for the animal health. And then the development phase happens again in the target species, and the molecules can move from research to registration much quicker. So it not only reduces the timeline, but with the acceleration and movement of this whole cycle towards left side, you can imagine that the percentages of or the probability of success also moves left side. So we can reject our compounds early on. That gives us greater chance of success with the selected candidates and molecules to be successful commercial products. So, to summarize, in the development phase on the human health side, it is basically rate limited because of the stage evaluation and sometimes getting the patient population which is fit for the evaluation, development evaluation is also challenging. And similarly, studies in very large number of patients are required to be done after thorough risk assessment and consensus or agreement with the regulators, which is an expensive process. Whereas on the animal health side, things can move faster, since I just said that since things can get started in the target species, so we can reduce the attrition risk early on. And although variation in species and breeds and animal size can be a challenge for the drug delivery, but still, that's manageable when we are able to select the candidates much sooner for the development pharmacology and the evaluation, efficacy evaluations. So bottom line, what it results into, the pharmaceutical development is on the critical path on the animal health side, whereas the clinical development is on the critical path on the human health side. So I think that should help everyone appreciate, my earlier statements that, there are similarities and differences in the two spaces. And now I want to get a little more technical and start with what are the, from a development perspective, what are unique challenges that we encounter during the drug development process. So as you can see here on the slide, this table captures various anatomical features across different species. So as you can see, there's a huge variation across the species. Of course, within the species, that is something that we are familiar with on the human health side. But other than the age and the weight and some other physiological differences within the humans, if you see across the species, there are supposed to be differences in the anatomical features, and you can see the range that we are talking about. For example, the weight, how it varies, or the stomach capacity, which can range from less than a liter to several liters in different species. And likewise, the intestinal length and the ratio of body to intestine. And there are a number of other anatomical. I just use these to reflect the differences. Then not to forget that it's just not the anatomical differences, but also the biochemical and physiological differences. So, the gastric and gastric intestinal secretions are different in both in terms of compositions, the pH, the volumes, and rate of secretion, etc., in different species. Likewise, bile flow can be different in different species. Emptying time from stomach and intestine can be. Now, let's see the metabolism and pK differences across the species, and I just picked up one example or a couple of examples here on this slide. So if you see different drugs, very commonly used drugs on the some of those on the human health side, and when those are administered to animals, depending on which species, the half-life can be very different. And for example, phenobarbital, which can be very short half-life in ruminants, can be very long half-life on the humans. And likewise, there are other examples where salicylates are, in cats are metabolized at an extremely slow rate so that we get a very long half-life. So one has to keep in mind when developing these drugs and the products, keep in mind the specificities of the species that we are dealing with. Another example here for amoxicillin. So if you see when amoxicillin is administered to different species, you can have very different responses seen in terms of the plasma drug concentration as a function of time, depending on species. So the cats are very slow or low metabolizers of amoxicillin compared to other species. This is just not true only for the active constituents or active drugs, but also for the excipients. So when we look at the response or the performance of different excipients in different animals, you'll see a wide range of the responses and differences, and that one has to keep in mind when developing such drug products in the system for the animals. For example, propylene glycol, which is a very common pharmaceutical ingredient on the human health side, is not so much accepted in some of the animal species. The phenolic compounds, again, commonly used as preservatives in the oral and or parenteral solutions, they produce toxicity in cats. Propylene glycol causes anemia in cats. There are many other examples. Maybe one more worth mentioning here is, ruminants can digest cellulose very well as their stomach, the rumen, the largest of the four stomachs, is designed and is conducive for digesting cellulose very well through the process of fermentation. So use of cellulose excipients, which are very common on the human side, or for example, use of HPMC as coating materials or the control release functional materials, these are not of any advantage if we want to accomplish the control release for ruminants. Now, I didn't go, in this presentation, I'm not going in deep into the technical aspects, but still I wanted to take the opportunity of highlighting what are the drug delivery challenges and innovation opportunities that one encounters when a person like me works in the animal health drug delivery space. So some of the key areas are listed on this slide, and one of those is the chewable dosage forms and palatability, very important area for the companion animals. We want the drugs and drug products to be offered and taken up by the dogs, cats, horses by free choice, so that one doesn't have to be running after the animals and pets to make them ingest the drug. And often this is accomplished by use of pelletants. These pelletants are of natural origin, so you can imagine the products of natural origin, which what kind of regulations and controls one has to deal with for bringing such compounds to a certain quality standard that can be used for reproducibility and the consistent quality of the material, handling of those materials into the GMP areas, and the risk of contamination and amenable to microbial growth, etc. So all of that has to be dealt with when developing these kind of dosage forms. And on top of it, the palatability studies, which are another type of in vivo studies, the way pharmacokinetic studies are done. The palatability studies are done to establish whether the drug product that one has developed is palatable to the desired targets and objectives or not. So that's the cycle of development it involves. Likewise, so in the ruminants or the cattle and sheep, we all know that those animals have multiple stomachs. The non-glandular largest stomach is human, and human, as I said, is a very conducive place for fermentation to happen. You can imagine the byproducts of fermentation are large amount of gases produced. The temperature of the local environment within the rumen can be higher than rest of the body. So, for example, in cattle, the stomach temperature is 38 to 42 degrees C, while rest of the body could be 37 degrees. So, all of those, pose challenge for the drug delivery scientist. There's almost like 600 liters of gas per day, which is produced, that one has to keep in mind that it doesn't impact the drug delivery. And there are precedents of commercializing products for the human, the products which can be called as human stable drug delivery systems. And one of the popular ones that I like the most from a technical challenge perspective was developing an osmotic pump and using the principles of gastric retention so that the drug is delivered for 130 days. So that kind of long or prolonged action and drug delivery is achievable in the animals innovation. I'll move on to the parenterals. The parenterals, we talk of the parenteral drug delivery, particularly if it is designed to be sustaining the drug released for slow absorption in the body. And on the human health side, while we talk of few days, there is, certainly some products in the animal health space which are as short as like 7-day long sustained release products, but many of those products are 6 months and 1 year long acting products, and those are multiparticulate, for example, PLGA-based drug products, which are once injected are slowly releasing the drug for long durations, such as 6 and 1 year's time. And there are examples of implantable pulsatile release drug delivery systems, so as to manage the hormonal therapies for cattle, the dairy cattle and or the cattle, to synchronize their estrus cycle. So the farmers have to deal with the reproduction cycle in a cost-effective and manageable way. There are a number of drug delivery devices which are required in the animal health, like, for example, needle-less injectors are popular for administration of drugs, quick administration without the help of veterinarians to animals. For example, in a farm setting where you have thousands of animals, cattle or sheep, and those need to be injected, vaccinated, etc. So there's a huge requirement of the delivery devices. And likewise, there are a few other delivery devices which fall somewhat within the purview and space of the pharmaceutical development, as the device and the drug are developed hand in hand. Then comes the intra-vaginal controlled drug delivery systems. As I said, for the estrous synchronization, pulsatile and controlled delivery of the hormones is required so as to manage the cycle in effective and efficient way. So there are a number of implantable, injectable delivery systems which are mostly polymer based for intravaginal implantation that are common in the space. Then again, topical drug delivery systems. This is a constant that a prolonged release or prolonged efficacy is a requirement in the animal health space, irrespective of the drug delivery route of administration. And just like other routes of administration from topical application, again, a prolonged efficacy is advantageous and is very desirable. But one can imagine, there is only very limited control that we can achieve through use of the concepts of transdermal patches because of the fur on the animal skin, the use of the any kind of devices or modalities for slow transdermal absorption, because once drug is applied on the skin, then the rate of permeation becomes the rate controlling aspect, and from a delivery perspective, the device used or the the mode of or the formulation basically becomes point there. So mostly these kind of systems, and there are precedences of utilizing very novel mechanisms for drug transport in such a way that drug once applied on the skin permeates and deposits into the skin, and then subsequently, instead of permeating into the systemic circulation, the drug moves laterally to move from the point of application to rest of the skin and dermal tissue. So such kind of mechanisms are very desirable, and there are products which have been commercialized based on such mechanisms. And another, the inherently trying to identify molecules which are having long biological half-life such that prolonged release is attainable for the topical application. So that's probably what I had on the technical front. If there are questions, I certainly will be happy to talk more about any of these aspects. But now I want to move on to, why I feel animal health and the research for the drug delivery and developing new drugs in the animal health space is so exciting, because one of the aspects that I covered so far, the challenges, and the other aspect as a standard requirement, I would say, is to meet these same regulatory and quality requirements while manufacturing these products. So there are no dilution of the regulatory requirements. In fact, the products are manufactured many a times in the same facilities, meeting the same GMP requirements. And likewise, from a quality perspective, there are no dilution of the quality requirements for the animal health, except for maybe one or two places where, for example, the requirement for the identifying and qualifying relative substance of the drug in the animal health space, the limits are slightly higher. So while in the human health side it is 0.1% and 0.3% respectively, on the animal health side it is 0.3 and 0.5%. So that's a very minimal relaxation, I would say, but still another aspect is, especially when we are developing the drugs for the food producing animals, the restrictions or the requirements are even more stringent on the animal health side, because any tissue residues which are remaining in the tissues before, or the milk or eggs, etc., after stopping the therapy is absolute not desirable and is very highly regulated area. So the development of drugs for the food producing animals is a lot more challenging compared to the development of drugs for the companion animals. So the main point I want to emphasize on this slide is, just like human health side, the FDA has a division for regulating the approval process for the animal health drugs. So there is CDER for the humans. FDA has the CBER and CDER, etc., various divisions, and similarly, CVM is the division that regulates the drugs for animal health. And likewise, in Europe, the EMA actually controls both human and veterinary use. The ICH guidelines, and there is a parallel organization called VICH, and all these organizations basically, which are catering to the drug approval process for animal health space, they have basically used the regulatory processes and guidances from their human side of the Now, I want to summarize this by saying that to be in vet med R&D, I feel really excited because you've got all the challenges that one has to manage on the human health side, with additional challenge of managing multiple species and the specific requirements of those species. The quality and regulatory requirements are same as on the human health side. The cost of development and margins of development are required to be low. The development timelines are much more accelerated than on the human health side, simply because of the shorter clinical development. So that makes it really interesting and exciting and very challenging to be in the health space. Now, here is an example where the two industries or the health spaces leverage from each another, and these are two, on the left hand side, two commercial products already commercialized. So one is Pfizer's, it's called Xeljanz. It's a JAK inhibitor, Janus kinase inhibitor, which basically was approved for rheumatoid arthritis in the year 2012. And now it's a blockbuster drug with sales in excess of 1 million in 2018. And this was around the same time when Pfizer was developing Xeljanz. We in the animal health, although at that time we were part of the Pfizer animal health, we were optimizing a candidate for a very different therapeutic category. And this, very structurally similar molecule, again for a Janus kinase inhibition mechanism of action, we were developing it for allergic dermatitis, for dermal portfolio. This product was approved in 2013, and from a perspective of the sales volume on the animal health side, anything in excess of 100 million is a blockbuster. So from that standard, this product is a blockbuster on the animal health space. But look at the one on the right hand side. So again, a structurally similar molecule in the same class, and as we decoded the mechanism and biology behind the pruritus and allergic dermatitis in the animal health for dogs, some of those mechanisms are existing on the human health side, and that triggered the thought, can this be leveraged for developing a new drug for allergic dermatitis in the human health side? And this is a product currently under development in Pfizer, and hopefully we'll see it very soon in the market. So again,
Sir, please once again unmute yourself, because there is so much noise. So please unmute yourself. I am muting all of them.
Okay.
Wait a second.
Okay. Can you hear me?
Yes, sir. We can hear you.
Okay. And hope you can see my slide. So point I'm trying to make on this slide is that there is a lot of synergy and opportunity for leveraging innovation between human and the animal health spaces. Now, before I get into the discussion about the COVID and impact on the animal health space, I want to just emphasize upon how the conflicting forces are going to drive us into the future. Now, if you see, the world population is growing, and will be more than 9 billion population within the next few years. And of course, there will be longer lifespans and higher affluence amongst the population, which means there'll be an increased demand for food and animal protein and coming from animals. And that requirement is just going to double up in next few years. But at the same time, the amount or these, the area of space that we currently are using to get the agricultural and the farm produce is not going to increase. It's probably going to only increase by 1%, and that basically means with the more or less similar resources, we have to feed a larger, much larger population and fulfill much larger food demand. The herd size for the farmers is likely to remain the same. Certainly, we have to be conscious about the environment and impact on the environment. So, there are going to be more and more regulations and desire to minimize the impact on any adverse impact on the environment because of any activities towards, even if producing towards food. And of course, with the welfare issues and the cost of food production is, continuing to increase the cost of farmers, for example, to manage their farming and population of farmed animals. So all of these conflicting and diagonally opposite, to be precise, driving forces are going to drive new technologies and various issues that during the course of the development we'll have to tackle and manage. I'll switch to how this current pandemic has really impacted the animal health industry, and most of this I would say is relevant for in general for other industries or even human health, not necessarily just limited to the animal health, but there are a few specificities. I would start with saying that in general, the pharmaceutical industry is a little bit of recession-proof. So we've seen in the past that whenever there is some economic recession, the pharmaceutical industry doesn't get impacted as much as some of the other industries do. And that, you can call it as a blessing for those who are in the pharmaceutical area and in this industry. Also, that this is you can call as a negative, because when there are some factors which are causing a very rapid growth of the industries in various areas, the pharmaceutical still remains pretty flat. So that's a very constant or recession-proof, or I would say stimulus-proof industry that we are in. And with 2020, as the COVID-19 and African swine fever have impacted the animal health industry, the interplay between these two and the overall outcome is very complex, and you can appreciate that in the next few bullets and the slides that I'm going to cover. As a result of this, you can imagine that several regulatory agencies, authorities, they're prioritized and they are switching to address and tackle the challenges of COVID-19, and few other aspects are deprioritized. So that's going to delay some of the drug approvals as a result of COVID-19. Thankfully, there are no shutdowns in the manufacturing organization, but certainly the productivity has got impacted, and irrespective of industry, the productivity has actually gone down to zero in some of the industries, but at least on the pharmaceutical side, we can say they are not that bad, and it has got down and compromised, but still we are doing much better than so much of other manufacturing sector. When we look at the companion animal segment, there is a greater humanization and owner-pet bonding and stronger bond, trend during the lockdown period. So, theoretically speaking, there should be greater demand for the products which are required to upkeep the health of those pets. But at the same time, on the counter direction, there's a reduced visit of the pet owners taking their pets to the vet clinics. That means there is some reduction in the vaccinations and treatments being afforded to the pet animals, and as much as 20 to 30% reduction of the pet visits in US, and Europe is even more significantly impacted. However, the anticipation is that it will very quickly reverse and will prove the resilience of this sector. Now we consider the livestock segment. There, the need for food hasn't gone away. We are the same population. We need the same amount of food for feeding the whole population. But with the closures of restaurants and eating places, the demand for the commercial and high-value protein has gone down. And instead, people are shifting to supermarkets, cheaper sources of food and protein. And so shift towards swine and poultry from beef and dairy has been observed. So that's basically, while one area might grow, the other area will get impacted because of this implication of lockdowns, primarily caused by the COVID-19 situation. The farmers, they are opting for cheaper medicines because of the cost pressures. They are also, what they otherwise use for the body muscle mass buildup. They are stopping to use those products so that they can slow down the body buildup for their farmed animals, and they, in the hope and anticipation that soon they'll overcome this the COVID-19 situation, and then they'll be able to bring back their business of farming and producing food from those animals. And this recession would certainly then, that means will have a much larger influence on the livestock business as in comparison to the companion animal business, and also maybe longer lasting as well, because it's a highly competitive and economy driven business as compared to the companion animal segment. Now, based on this, various companies have actually revised their revenue growth rate forecasts for this year and for next few years. It is likely to happen. There would be some downward trends into the growth forecasts, and that's very realistic to expect in coming years. Now, what this means, the businesses are trying to find ways to survive. They are trying to find ways to innovate and evolve into new way of doing things. So in simple words, we probably are never going back to our previous normal, or it is going to take a long time to go back to previous normal. But the industry is looking for opportunities and trying to innovate to move on the new normal. So how that is going to happen on the online boost. So there's so much of emphasis that we've already seen in our daily lives. The online ways of doing things, the commerce, the home delivery, and that is applicable for the veterinary products distribution and sales and supply chain. Increased investment and adopting these digital technologies is the way forward. There is nothing but this is the way forward, and very quickly I think organizations and businesses have realized, and they are starting to move in that direction to interact with the partners, stakeholders, customers, using those online tools and engaging them into the business dealings. Very likely that in the coming years, there would be some regulations and relaxations or changes in the regulations that will allow more and more of telehealth or telemedicine around the world, which currently at many places is restricted. So that's possible outcome of this situation. From an R&D perspective, although companies would find it difficult to preserve a constant cash flow into the R&D, but I think everyone realizes it is important, and it will be very short-sighted if one stops fueling the R&D investment, because in the long run that is going to be then a stop, the showstopper for the organizations to survive in a very challenging and competitive environment, which solely relies on the innovation. So that means what companies are likely to do, they are going to make their investment choices. They're going to prioritize which products they would shun and discard maybe out of their pipelines, and which products they will prioritize and continue to fund for development and bring those to the commercial as soon as possible. It is also likely that, as I was explaining to you earlier, the closer the product is towards the regulatory filing, the better is the chance of success. So it is likely that from a short-term perspective, companies might invest into those products which are closest to the commercialization, and then take the long-term the objectives of developing new drugs as the second priority. The business models are likely to change, not just that the bringing in the online and digital technologies into the business, but diversification of business is likely to happen, so that, for example, companies which are focused into one specific area and get impacted hugely whenever these kind of pandemics or other economic events happen, then they want to diversify to immunize themselves for such scenarios. So the minimal impact is there. The focus on better management of the capital, inventory, warehousing, logistics, supply chain, etc. So making processes more efficient, more cost effective, that's going to be one of the focus to be continuing to be profitable. There'll be opportunities for growth, and particularly in animal health. The unmet needs are still there, so those opportunities are still existing. It'll continue to fuel the research investments by the companies and bring up innovative products. But from a shorter term perspective, there could be more investment into the geographical markets, which would demonstrate a quicker recovery from COVID-19. So companies would propel the products and new products and technologies into those markets sooner than others, where the recovery from COVID-19 would be slower. And now probably in future, the countries and regions would be micro managed to an extent, because saying that Europe or France or UK has this much of potential for X drug is probably going to be changing into specific area and regions even to the level of within a country, which might recover at different rates from this COVID-19 impact. So there'll be a lot of micro look into that aspect. From some of the industry experts, it's predicted that it'll take roughly about 2 to 3 years to stabilize and get to that new normal. And this rate and recovery depends on a couple of important aspects. Number one, how does this, the whole impact, the coronavirus impact, COVID impact, and the economical implications, would they be like following a V-shaped pattern or a U-shaped pattern or a W-shaped global economic recovery patterns? That's yet to be seen. More and more people are inclined towards saying that there is going to be a W-shaped pattern, meaning an area or region or country which might declare themselves to be able to manage the COVID situation, might come back into the second wave of infection, and then we'll have to deal with it until there is a real therapy and or a vaccine available to prevent this from happening. So this will control the recovery path and duration. Now, various companies, various sectors are developing their short-term strategies and long-term strategies within the animal health space, and there are lots and lots of recommendations coming from experts, what and how companies can do to deal in a short term for the companion animal health space, and likewise for food animals, and from a long-term perspective. Again, I'll not get into the details of these strategies, but obviously, different companies are going to take different strategies for their own individual objectives and situations, because every company may not have the same balance sheet to sponsor or fund the initiatives and the strategies that they might want to take, and that will derive the choice of strategies they're going to take. So I want to try to start summarizing this talk basically by saying we've seen a healthy growth within the animal health space. You can see bumps here and there. Those are largely because of one or the other large incident that happened at that particular given point of time. So this graph shows the combined revenues of top 20 companies, and the line graph shows the growth rate for those same 20 companies. And you can see, the line, while the revenues are growing at a very consistent and healthy growth rates, but the growth rate per se, average growth rate per se on an annual basis has varied a lot, and that's because of some or certain incidents that have happened in those areas or those regions and those years particularly. So there are going to be such situations in future also which will bring the growth rate down or up, but I think what is important is whether we can meet this target that was projected way back in 2018, whether this will be realized in 2035, with a $67 billion from animal health industry, that remains to be seen. But certainly the COVID in 2019 and 20 has high potential of making a bump into that and adversely impact this projection. Now, what is the biggest take home? I think let's look at the positive side, blessing in disguise, we can, as best as we can, leverage and capture. So there have been multiple occasions when, in last 2 decades, when the digital, there's been a push to the digital technologies and industry embracing those technologies from time to time. And the latest one, COVID-19, one can say, is the latest push, and it is going to transform how the businesses would be done in future with these digital technologies. And that's just not for the animal health industry, that's across the pharmaceutical industry and even beyond pharmaceutical industries. I would finally summarize and with few key messages that the animal health space is somewhat unique, both in terms of the commercial aspects and the technical aspects. Though the science involved in developing the pharmaceutical products, the pharmaceutical research, the principles involved, everything remains the same. There's not much of difference in developing the science used in developing animal health product from what is used for the human health product. Change is often slow, or sometimes it is even forced by extraordinary circumstances. And let's assume and take it that COVID-19 is that one extraordinary situation that we are currently dealing with, and this is going to propel the change for future. And finally, specific to animal health pharma industry, that we will strive and emerge stronger to a new normal in coming days and years. Lastly, I just heard this in a recent interview by Dr. Tedros Ghebreyesus, who is WHO Director General. So according to him, COVID-19 is giving us an opportunity to come together as one humanity, to work together, to learn together, and grow together. Now, this can mean different things to different people. From my perspective, I think for the industry, for the humanity in general, it is giving us an opportunity to do things differently. It's probably also an opportunity we are seeing. We need to realize that Mother Nature also has a much bigger control, and that needs to be respected. And we can't just keep on abusing and exploiting the nature, and needs to pay attention to things. And in some of the reports you must have seen that this lockdown has given an opportunity for nature to revive. With that, my last slide here. These are some of the recent innovative drug products that Zoetis brought in, and Zoetis maintains the leadership in bringing such innovative products. Most of these are NCEs, and most of these that you can see are in very different therapeutic areas. So for the weight loss in companion animals, to motion sickness in companion animals, to cancer, the mast cell cancer in dogs, to allergic dermatitis and antiparasitics, etc., etc. So there's a long list. I just captured few which are recent NCE products that Zoetis has brought in the market. I'll pause here and thank for your patient listening. Maybe we can open up for questions if any.
So any questions? Do we have any questions?
Sir, thank you, sir. Sir, very nice presentation. Sir, my questions is related to the COVID-19. Sir, just I am asked, what is the role of pharmacist post COVID conditions, and how it correlate with the animal health?
Sure. Yeah, I'll try to answer that. I think this topic was touched upon earlier during the morning session also, that the pharmacists are important players into providing the, we are the first touch points, as Dr. Sanjay Jain had said earlier in his presentation. So as a pharmacist, we certainly can play a role in, first of all, keeping ourselves safe and educating others how to be safe. We understand the science and, what are the health risks from the virus, how it is transmitted. So I think we can play an important role in educating others on those aspects and how to protect ourselves from the infestations. The other aspect, pharmacists in the hospital settings can and are actually playing the role of providing the first healthcare, first aid care that is necessary, that is needed in those hospital settings, and supporting the medics and the paramedics to tackle the overall situation and managing the healthcare for people who are requiring hospitalizations and intensive care and whatnot. So those are important aspects, I think, how pharmacists can play a role. And for future or in the animal health care, I certainly see the pharmaceutical scientists who are either in animal health or in the human health, irrespective. I think those who are into the pharmaceutical research can play an important role into developing those novel therapies and ways of treating and or preventing the disease. So I'm sure many of us who are into the R&D are playing our roles into this pursuit. May not be directly applicable to find a drug for COVID-19, but certainly maybe some of us are actually. But there are other comorbidities which are relevant, and the contributions made in those areas are equally important. That's my thought on. I hope I answered your question.
Yes, sir. Thank you, sir. Thank you very much.
Do we have any other questions?
Yeah.
Any other questions? There were a lot of raised hands. I don't know whether that was for questions.
मिनट बैठेंगी सब सामान ले आइए ना उठा के और भी सामान ले उठा ला और कुछ नहीं है अरे फल वल सब तब ऊपर आना है सब उठा लो
I think that if we do not have any questions, we should thank Dr. Anurag Soor, who has done a wonderful job, and he has really given us an entirely new area. And till now, it was definitely not mainstream.
Sir, ma'am, I have a question.
Okay, carry on. Please ask.
Hello.
Please ask your question.
Yes, ma'am. I have read it somewhere that the possible treatment for this pandemic is in herbal. Like nowadays, herbal treatments are also being very in these days. Like we are switching ourselves towards herbal therapy. So I have read it somewhere that curcumin along with liposomes or making the curcumin liposomes, it is possible to treat this. Is it? I am not sure about it. So I just wanted to ask that whether, except like it has the antibiotic property as well. So is it possible?
So yeah, I'm not sure if I'm the right person because I'm not a medic, and my limited knowledge and understanding is that to best of my knowledge, I don't think there is any established treatment or therapy using curcumin or something like that has been established as yet. Maybe there are some trials going on, but not something that in my knowledge exists as a therapy. However, having said that, I think during the earlier presentation, I'm getting a lot of echo, so I hope you guys can hear me and can follow me.
Again, I am muting all. I am muting all and unmute yourself. Mute for a support. Sir, unmute your device.
Okay. Question करना? सर एक क्वेश्चन है और कब से क्या क्वेश्चन अभी दिमाग में आ गया सर ऑडिबल मार्क्स निकाल लो
Yeah, can you hear me?
Yes, sir,
Okay.
we can hear.
Yeah, so I was saying that to best of my knowledge, I do not think there is an established treatment using curcumin for COVID-19. There may be some trials. There may be some trials going on, but as a treatment, I'm not very sure that it is established as yet. Having said that, but I would also say we all know the general properties and the health benefits of curcumin, and for those reasons, this should be considered as a immune boosting or antibacterial substance of natural addition which can help. But I'm sorry, I cannot really say for sure where there's an established efficacy of curcumin.
Sir, I have a question for you.
Yeah, please.
First of all, thank you for such a good lecture, sir. And my little question is there. There is a very big myth related to the non-veg and vegetarian. Means persons not taking the meat or any chicken like in the market, what happens? Then any relation with this to spread the COVID-19 or this through the animals? There is the possibilities.
Yeah. So again, a question which is being debated from, the lowest level to the highest level of scientific community and even the national governments, etc. So a lot of debate is going on. To my understanding, I don't think there is an established link as of now. Of course, a COVID causing virus, the novel coronavirus, it's established, although some might continue to deny or accept this, but to a great extent, I think there is some facts available that the virus originated or mutated in bats, and from bats it came to the animals called pangolin, and from there it then got transmitted into following the chain into humans. So there's certainly involvement of the animals as the host for this virus and many other viruses. But I'm not sure whether we can say a vegetarian is immune or a vegetarian will not get an infestation, because once it has come into humans, then its transmission is dependent or is through the respiratory tract and the droplets. So, the diet certainly doesn't play a role in further transmission from a human to human. Right? So one has to keep that in mind. Does that help?
I think most of the questions have been answered by Dr. Anurag Shodh. So I thank you, Dr. Anurag Shodh, for his valuable lecture and sharing knowledge to our scholars and different students. The years of research and depth of understanding of animal dosage form and your ability to present this topic in related to the COVID-19 in such an interesting way, it definitely produced one of the most memorable this evening session. I really thank you to Dr. Anurag, and keep this mind in that in future we will definitely again being a part of your this interacting knowledge and some of the important topic we again discuss with you, with our students and scholars. Thank you again for your sharing time and a long lecture. So thank you, Dr. Anurag Shodh.
Thank you very much for the opportunity, Professor Alok, and I appreciate the patient listening, and it was indeed a pleasure to be part of this webinar. Thank you.
Thank you so much, sir.
Yes, please.
Professor Krishnamurti Bhatt, presently serving to the Department of Pharmaceutical Quality Assurance, Manipal College of Pharmaceutical Science, Manipal. His B Pharm is from JSS Mysore and master's degree in quality assurance from Alam College of Ahmedabad, and he did his PhD from Gujarat University. His main topic and main research towards the quality assurance. So I believe that he always assure for the quality of work in his life also.
No problem, sir.
He is working earlier in a chief scientist in biomedical operations in Manipal's Akonova HSCRC Manipal, and earlier then he served as AB Institute of Pharmaceutical Science and Research in Gandhinagar, Gujarat, with me also during that time. He has been awarded with several posters and presentations during this journey, and he has been a part of different projects also, like Manipal Multidisciplinary Development Research Center, AICG MODROB, DST and DST SERB, having 2010 to 2013, 13 to 2018, and 2015 to 2018 of a different project of 9 lakhs to 65 lakhs also. He has attended many international conferences and national conferences, including Second Asian Federation Pharmaceutical Conferences in Malaysia, National University of Singapore, and specific regional ISFX meeting in Bangkok and Japan also. He is a life member of APTI and IPGA. He has been recently received a grant of European Union under MMRD from Government of India under AICT MODROP on study of xenobiotics totaling of more than 1.5 crore. He has published 39 international and national reputed journals, and having a lot of presentation on national and international papers and seminars. Today is talking about career in regulatory affairs, opportunities for pharmacists especially. So I request Dr. Krishnamurti Bhatt to present his topic. Thank you.
Thank you, Alok, for this very unique opportunity to interact with more than 200 young pharmacists. Alok, am I audible?
Yeah, you are audible.
Fine. Okay. Slides are visible?
Yeah, visible.
Slides are visible. Fine. Okay. So I will start my talk, and anytime in between you can stop me. All participants, please feel free to
ask any doubts you have, whenever you have. And then I see a lot of hands being raised. Sarika Singh, Paul is one, and then there are Sonia and many more. Only 2, 3 are visible to me. Do you have any doubts? Would you like to, those who have raised their hands?
First, then we'll ask the questions if required.
No, but then why there are those raised hands there? See, career opportunity in pharmaceutical regulatory affairs. The reason why I have selected this is, as of now there are a lot of misconceptions in people, especially people from non-pharmacy background, which is also fueled by media, stating that we will have drug for the COVID in another 6 months or 12 months, 1 year. Except for a pharmacist, nobody else would know how difficult or how practically impossible it is to get a drug to the market in 6 months or 1 year, or even for that matter, next 2 years, specific drugs. Right? And whereas the efforts on people have been concentrated, essentially what is being done and largely misrepresented in media, whether it is the social media, electronic media, or print media, wherever it is that the repurposing of the drug is construed as new drug development. Okay, now new drug development, as all of us know, is not a day's job, or not a month's job, or not a year's job. It takes 10 to 12 years for a new drug, new specific drug for this COVID-19 to come to the market. Okay, let all of us be very clear on that. What is being done and what is being reported in various parts of the media is the repurposing of the existing drug itself is wrongly construed as the new drug development. Now, so why a regulatory affairs comes into picture here? The regulations for repurposing a drug and regulations for developing a new drug are totally different. Different because existing an approved drug for something. Okay, now many of you may not have a clear idea what repurposing is. Repurposing is essentially the off-label usage of a drug. Right? For example, if a drug which is used for serious respiratory infection, and that is being tried on a COVID-19 patient, essentially that drug, like you hear quite a lot about the remdesivir and then hydroxychloroquine, etc. Hydroxychloroquine, of course, is not an antiviral per se; it is a antibacterial drug. Now, for various reasons of pharmacology, they also show some effect on COVID. Now, legally or from regulatory point of view, a physician or even a patient cannot use this drug straight away on a COVID patient. This needs to be studied, and only then you can use them. That is called as repurposing. That means the drug has been already approved for a specific disease, and then you are trying it for some other indication or a different disease, and then you try to prove whether that drug works for COVID-19 in this specific case, in the present context, if you have to talk, whether it works for a specific, specifically for COVID-19 or not. Now, having said this, now only a regulatory specialist would understand the difference between getting the approval for a drug, which is already a repurposed approval of a drug for COVID-19, or getting approval for a drug which to treat COVID-19 for already approved drug, or for a new drug molecule. Only an expert would know. Or most of us pharmacists would know this. Now, in this scenario, what happens is, it is not one drug or two drugs which are being tried in COVID. There are multiple drugs. Somebody who understands the virus, the viral life cycle and its whole physiology would try anything which has some chance of acting against the particular disease. Now, with that being the case, you cannot just do it. You still need to follow some regulatory processes, and those processes, of course, would be much lesser than getting the new drug approved, because the drug which is already approved for some other disease has been proved its safety. So, proving safety is not an objective when you are repurposing. When you are repurposing, forget about repurposing. Whenever we talk about approving a drug, we always look at three aspects of a drug. One is the safety, the second one is efficacy, and third one is quality. Right? These are the three pillars of any drug approval. And a repurposed drug would have already proved its safety and quality for some other disease, but that is there for human. Safety is not a disease specific, safety is a biological system specific. That means a drug which is safe for human being, whatever reason you give it, it is safe. So, when you are repurposing, you have the drug has been proved to be safe, proved to be of quality. Now, only thing what is left is efficacy, is something which you have to prove for a particular disease. And when multiple number of drugs are being tried for the COVID-19, repurposing of many drugs being done, then obviously there will be lot of demand or lot of regulatory requirement which needs to be met, and the regulatory professionals would be in high demand. That's the reason why I have selected this topic for this webinar to present about the regulatory aspects. Now, coming to some of the numbers, out of every dollar spent by American consumer, 25% of that, 25% of the total spending of the products goes to the regulated services. If American, because most of these studies would be American based, because they do those studies. It's not that the situation would be greatly different in India as well. Right? Because the data is available there, and that's why we talk about statistics. As far as statistics is concerned, we talk about America. Wherever it's not specific to this or specific to me, most of the speakers would only give you the detailed data from US, America, United States of America, essentially because the data is available and it is available in the public domain. That's the reason. Right? So 25% of every dollar spent by an American goes to a product which is regulated by FDA. FDA is Food and Drug Administration of United States of America specifically. Now you may ask how 25% of the dollars spent, 20% of the money spent goes. It is not only the drug which is being regulated by FDA. FDA regulates drugs, foods, beverages, cosmetics, and then herbal preparations, etc., etc. And all those regulated products, an American spends 25% of its money on that. Okay. Even the medical devices is another which is of late gaining huge importance worldwide, and that is also a volume builder as far as the pharmaceutical pharmacists are concerned. So that's another area where most of us can make your career as well. Now, so because of this, the demand for regulatory people is always increasing. Now, what exactly is regulatory affairs profession is all about? What do they do? Regulatory affairs is an industry which oversees how food, drugs, and medical products are developed, tested, manufactured, marketed, distributed to certify that they meet the regulatory standards for human use. That means every country, every 7-year country on this earth has some regulations governing the manufacturing and distribution of medicine, essentially the quality of medicine, but not only quality of medicine, quality of food, quality of medical devices, all these things there are regulations. Now these regulations essentially need to be implemented, and regulatory professionals are the ones who are helping in implement or ensuring that these regulations are followed by the manufacturers, various manufacturers of these products, that means drugs, medical devices, and food. Now, this is done in drug and medical device profession. It is done at research and development level, clinical trials, and once the trial, that is the clinical trial phase 3 is complete, then the submission of the document. After the submission of the document, you get something called as MAH, marketing authorization, and that marketing authorization, once it is obtained, then the drug can be marketed. So during marketing, there are certain regulations, and there are post-marketing regulations like SUPAC and DPSUR, animal reports, etc., etc. And then phase 4 studies, that is the market, that is pharmacovigilance or post-marketing surveillance. Plus, we also have regulations regarding the distribution of drugs, which of course will happen after the drugs start getting marketed. So with all these things, these are the places where essentially regulatory affairs professional would come into picture. And as far as the foods are concerned, the products, facilities, manufacturing operations, etc., is again where the drug regulatory profession would come into picture. There is, right. There was some technical problem, of course. For the short period, you could not see the slides. Now I think all of you can see slides, right? So now this regulatory professionals, because of these diverse areas in which regulations are there, and complying with those regulations, ensuring that company complies with those regulations is regulatory affairs professional job. We have the various disciplines on which our regulatory affairs professional can work, like law, economics, public policy, health, and other science parts of it. And then in spite of wherever we are working, the only aim of all regulatory affairs professional, whether you are in R&D, whether you are in clinical trials, or whether you are in food industry, the only objective of all of this thing is to facilitate commercialization of safe and effective products and services to the needy. That is the only goal with which all of us are working. Now, irrespective of the, so that is why you will find the regulatory affairs professional in clinical studies, you will find regulatory affairs professionals in submission, that is the document submission for the new drugs or the abbreviated new or generic drugs, as you know, ANDA, and then labeling is another very, very important aspect of regulations. There are a lot of new regulations coming in labeling, and then of course food regulations is another where the pharmacy postgraduates and experts from pharmacy can play a major role. Irrespective of the work functionality, whether you work in clinical trials or whether you work in submissions or whether you work for food, the work area would include the following. That is, you invariably have to analyze new and existing regulations and then review the documents, various documents related to the product, and ensure the compliance with the standards, whatever is mentioned, and then in case there are some problems with reference to regulatory compliance, suggest some remedy or the corrective actions for that, and then act as a liaison between manufacturing organizations and the regulatory agencies. Now, senior level regulatory professionals would also involved in business decisions. Business decisions essentially because, say for example, every regulatory compliance would have a cost. Regulatory compliance does not come free or it's not even a cheap affair. Regulatory compliance is an expensive affair. Now with that, if as a company you are spending some $1 million US or equivalent, whichever country it is, whether in US, Brazil, or EU, UK, wherever you spend $1 million and the market size or the expected market for that product there is only $2 million, then probably though it is easier to comply with that, but it may not be a good proposal for the company to enter into that market. Whereas you spend some $10,000 and then the market is $1 million, and then as a company you would always suggest or you'd always like to go for that market where you spend less and proportionately get more returns than the absolute number. Market X may be worth in 2 lakhs, but to comply with the regulations you need to spend $1 million, whereas market Y is only $1 million, but regulatory compliance cost is $10,000. And then as a company, it is always good for you to select 2-3 markets of type Y than having one market of type X. Right now, this is where even regulatory experts can have a very strategic, can influence a very strategic business decision. This thing comes only when you have the real expertise in the whole international regulatory affairs of most of the countries. Right? And now, most of you might have, might not be the specialist on regulatory affairs profession, but one thing for sure is all of we as pharmacists have studied drugs and cosmetics, pharmaceutical jurisprudence, or forensic pharmacy, whatever you might have called in undergraduation. Essentially, in that, all of us remember one part or one this thing, that is Drugs and Cosmetic Act and Rules 1940 and 45. And I'm sure during my period, that's 3 decades back, and for you people, which is just 3 years back, the story is saying, the story is we never understood what is written there. So for the exams, we somehow try to understand some parts of those regulations and then come back and write something what we understand and do it. What does it mean? That essentially means the language of regulations is not easy. Right? Language of regulations is not something which I and you talk. Right? It's a very complicated and there's a lot of hidden meanings in the regulatory language. Right? So the expertise also does. decimate or understand those languages and then try to interpret how this regulation is going to affect my company or my business, and then communicate that to all people concerned, and then get the product compliant. Sure. And so any new development in the regulatory parlance or regulatory arena, anything which is coming, like now, if you see the latest example again, is the regulatory professionals are the ones who are most worried about or most understood about the Brexit than anybody else. You might be knowing that Brexit was to come from EMA, whatever you call either of them, right? UK's regulatory authority or EU's regulatory authority, and it was supposed to happen in May 2020, and it is postponed to September 2020 because of the present situation worldwide. And it is the regulatory affairs professional is the first one to look at its implications. How is it going to affect the product? Because of course, that's altogether a different volume. We can talk about a few hours only on this, Brexit and the effect of Brexit on the regulatory, on the regulations of drugs or the position of drugs in EU and UK. But essentially, we are the ones who know it immediately and take that into cognizance and accordingly remold or reprioritize our work. And so essentially, regulatory profession is not a job; it's a mission. Okay, and of course there are a lot of problems, but many times the problems are the solutions. Finding solutions is a challenge, right? And most of the regulatory affairs work in pharmaceutical, medical device, biotechnology, and also food. And the others work in consultation. Consultation is another, very lucrative method in regulatory or another lucrative career prospect in regulatory affairs. Essentially, not a consultant for US FDA or EU or those regulated countries, but for semi-regulated countries like Middle East countries or the African countries which import a lot of drugs from India, and then who does not have a very strict regulatory guidelines. So you essentially act as consultant for, and then even small scale or medium scale companies can market their products there, but they need some sort of documentation, some sort of submission, some sort of approval. For these things, you can always act as a consultant, right? It must be acting for, when we say consultant, people think, okay, consultant for US FDA, consultant for EMEA. No, that's not all that easy, but these small countries and semi-regulated countries are always easier. There are a lot of people who are doing it, and then they are doing it very successfully. A good number of my own students are doing that, and then they are earning a good amount of money. Right? And then of course, CROs are another lucrative ground for regulators to work, and so that is why CROs also require a lot of regulatory experts. And then the advantage there again is you have with any drug, whether it is a new drug or whether it is a generic drug, whether it's a biotechnology product, clinical trials are must, and CROs. Without CROs, none of them, even devices or biotechnology products, some of the herbal products, and none of the drugs that is new drugs or generic drugs enter market without the clinical trials, of course. The depth and the methodology, protocols and regulations are different, but clinical trials are mandatory. So if you are expert, if you are working in clinical trials industry as a regulatory expert, and then your platform is very big, right? So that is why there are a lot of people you will also find even in the phase 4 clinical trials, that is that's pharmacovigilance, right? Now, but how do we progress as a regulatory affairs professional? Many times that is something which is very oblique, it's not very clear. Because it's a new profession. The reason is not that there is any ambiguity. The problem, the reason is it's a very new profile, a very new job. So how do you start? You start with this, and 5 years down the line you reach Y position, and 10 years down the line you reach Z position. No, that is not there, not very clearly established for the regulatory affairs professional. The other reason is the background of regulatory professionals also is very varied. It's not only pharmacy, but there are many other regulatory professionals. There are many other professions who claim to be experts in regulatory affairs as of now. And especially in the devices, you hardly find devices, I mean medical devices, hardly find any pharmacy professional in regulatory affairs. So, and 2016 survey by RAPS says that more than 88% of the people started their career in a different domain and then migrated to regulatory rather than working directly with regulatory. Now, why is this happening? That's essentially because I told there is a lot of scope and there's a lot of jobs available in regulatory affairs. The problem is companies are not able to find suitable or competent candidates to fill those jobs. So that is why anybody who has competency, they don't look into their educational qualification, their previous work record, they just hire them. So what is the solution? The solution is we pharmacists should become the experts in regulatory, drug regulatory, device regulatory, and then clinical trial regulatory. In all these areas, we should develop our expertise and then claim back whatever the lost glory we had. Or our rightful position. I cannot say lost glory, but because we never had glory in that area, we should claim our rightful position there and then make. Now, how do we do it? Develop expertise in some of the following emerging areas like ECTD. You might have heard most of the countries. The US has made ECTD compulsory from May 2018, and subsequently EU has made it compulsory. And then there are many other agencies who are in the verge of doing it. The ASEAN is making it, GCC is making it. So ECTD, or electronic document submission, is becoming very, very critical, or is becoming very important. So you need to get expertise in that. There are a lot of softwares available. You should know at least, but the platform for most of those softwares are same. The granularity structure remains same. So if you can master one of those softwares, then of course other softwares is not very difficult. But you need to be very, very convenient or very comfortable with this ECT, electronic common technical document submission. And then blockchain is another, largely for distribution. There are a lot of regulations changing with distribution and operations per se. So blockchain is another, it is a transparent and authentic distribution networking. So that is gaining very high importance. So if you learn that, and then of late, if you see the social media, like may not be WhatsApp or very general social media like that, but some social media like LinkedIn, Twitter at times, but LinkedIn is largely used for marketing the product. Now, there are regulations which govern advertisement of the product, but when those regulations were written, these these social medias never existed. For most of the countries, when these regulations, restrictions on, regulations on advertisement was written, social media was not existed. So now, how can we? But LinkedIn and Twitter are largely being used for advertising products indirectly or directly. Now, in such cases, how do you interpret that result? And see, all of a sudden tomorrow you may get a notice by the FDA for advertising product A in LinkedIn. So in that case, as a regulatory expert, you can justify whatever you have done, or you can also show the company a right way of doing those social advertisements. And then regulatory affairs is a very dynamic profession. That means something which is relevant today is not relevant tomorrow. They keep changing, and that is why reading continuously some of the sources which I have mentioned, like DIA and IMRD, with regulations and devices, etc. Keep reading. That's always very, very helpful. That's what keeps you updated. That's what keeps you running coin in the market. If you stop reading, you become obsolete in the regulatory affairs profession. And then even the regulatory affairs, because again it is not something which you do directly. You compile, you help others to do their work. So you need to be cross-functional experts to say, for example, to understand GMP regulations, you should thoroughly understand drug manufacturing. To understand, implement, and interpret GLP regulations, you should thoroughly know what laboratory operations is. Right? So you should be an analyst, you should be a manufacturing chemist, you should be a research chemist, everything in one, and that comes by, of course, by reading, not by practice. You cannot work as a manufacturing chemist for 2 years, work as chemist for 2 years, 2 years for as the R&D chemist, and then come back and join regulatory. So you need to sharpen, you need to keep your keep reading, keep understanding, and keep researching on some of these areas, whatever growth is happening. And then the international regulations are very wide, so they don't stop at any one point. You need to keep updating, you need to read all international regulations. Though there are a lot of efforts on harmonization, has not been very successful even now. There are a lot of issues. Now, if you see ICH, one of the major big phase of harmonization, if you see, that itself is not very successful. So harmonization, yes, that is happening, that should happen, but still countries would have their own regulations. If, for example, if I have to say a very simple example, ICH, Japan is a signatory to ICH, right? US, Japan, and UK are, EU are the 3 ICH regions that started with ICH. Now, Japan has its own regulations for stability studies, not an ICS regulation. They don't follow ICS regulation. Now, so that is why harmonization, yes, harmonization will help, but harmonization is not very effective. So you need to know all this thing, all international regulations, every country, whatever changes they are making. Of course, now it has become very simple. You subscribe to those regulatory agency newsletters and then put them in something called as RSS feed. So any changes which they make, you will get it. Plus, get hands-on experience as much as possible, and then network with people, network with industry experts, network with the regulatory experts, and then try to find out what are your strengths, what are your weaknesses, and how it is going to happen, right? And this I think largely I have talked already, because I am nearing the end of my time. I probably have I'm left with another 2-3 minutes. So this I have already talked at different this thing, and then okay, what do you need as an individual? What skills you need to develop? One is good analytical skill. Analytical skill means not the instrumental or chemical analysis. What we are talking about, we're talking about the analysis of the situation, analysis of the regulation, the implication of the regulations, etc. That is something which we need to do. And then we also, if you want to be successful in regulatory, you need to have good negotiation skills, and then the presentation skills, because you are going to present your data to regulators. You are going to convince your teams, your juniors, or your other peers, your contemporaries, to implement some regulations, to create some documents, etc., or to put some results in a particular format which meets the regulatory requirements of country X. So with all these things, you need to have a very good presentation and convincing skills, which also goes without saying that you need to have a good communication and language skills. Presentation is one part. You should be able to communicate. You should be able to talk in a language which people can understand, and then it should be clear. Your message should be crisp and clear, and then of course, because a lot of such work is done with computer, it goes without saying that you need to have good amount of computer knowledge, how to prepare the slides and how to do the presentation, how to do the calculations using Excel, etc., etc. And then you need to keep updated with the all regulations, whatever changes which are happening in the regulatory arena. Okay, with this I will end my talk. This is the place where I am working. This is a university, and this is the college where I am sitting right now. And thank you very much. If there are any questions, I'd be happy to take it. Otherwise, to Dr. Alok.
Yeah. Is there any question from the audience? Miss Sonia, you can unmute your sound and ask the question. So I think audience are not having asked questions. Health is an investment in our collective future. Thank you, Dr. Krishnamurthy Bhatt, for your valuable lectures on regulatory affairs and the opportunity for the pharmacy profession. I would like to express our profound gratitude to Dr. Krishnamurthy Bhatt for enriching our knowledge regarding regulation and their important part of FDA, and of course what is the important requirement for the professionals who want to join as a regulatory affairs team. So I'm really very thankful for Dr. Bhatt for giving his time and profound knowledge, and definitely it will be helpful for our scholars or students of master's degree when you can join the field in future. And of course, in this COVID-19, post-COVID-19 era, we definitely think about what are the important we can do for this regulatory affairs as a part of Indian economy or Indian pharmaceutical future. Thank you, Dr. Bhatt.
Thank you, sir.
So I think we are now concluding this national webinar series on the topic of oceanic requirement for healthcare post-COVID-19. I would like to express my gratitude to our speakers. In the morning session, we hear Professor S.K. Jain, Professor and Head, Department of Pharmaceutical Science, Dr. Harisingh Gaur Vishwavidyalaya, Sagar. And in the next lecture from Professor Shubhini A. Sharaf, Professor and Head, Department of Pharmaceutical Science and School of Biotechnology, Baba Bhimrao Ambedkar Central University, Lucknow. And I also express my gratitude to evening session speakers, Dr. Anurag Sood, for his thought-provoking lectures on animal dosage form and their ability to making a different dosage form in the animal research. And then finally, I also thankful to Professor K.M. Bhatt from Manipal Institute of Pharmacy, Mahe, for his opportunity on regulatory affairs for the pharmacist in this era. I'm really thankful to all the participants who have very patiently listened this lectures and also raised some questions and getting their answers from our honorable speakers. So today we have completed our this series. Most probably we'll again go for some other webinar in this pharmaceutical field. So definitely we'll look forward to meet you in this webinar. Thank you all, and thank you to all the participants, especially to this pharmaceutical field. Thank you.